with the restaurants and this open street stuff? Open restaurant.
Well, the rest of where there's open restaurants, and then there's the open street.
Right.
And then there's like the
open streets with open restaurants like Dyckman.
I mean, it's not just about Dyckman, it's everybody. Everybody
came to y'all's meeting. That's right.
We've had every meeting we have businesses come. So
yeah, she's is she the only one with the open street?
No. Open streets. Okay, there's a couple of things. There's open restaurants. That's the only thing the restaurants have anything to do with. The restaurants are the restaurants are open restaurants. Are right. It's not they don't have restaurants don't have anything to do with the other thing, which is allowing retailers to have street fronts now. That has nothing to do with the restaurants. Those are two separate things.
No, so my question was because I mentioned in TNT, both of those are DOT programs. Was there going to be any discussion about making this permanent? Because
open restaurants already is.
He's done it by fiat, but I think the community board should weigh in on it. And it hits a lot of committees. It hits this one. It hits business development. It hits
right, but it's already a law. He's already made it permanent. So only thing we'd be doing would just be making a statement, and that's really up to the chair. I'm not the chair of business development, so
think about which committees it would hit the most.
I don't know. I mean, to
me, it's a public health issue because they put up these like little pods, plastic pods around tables. They were like little COVID things because you could never sterilize them between parties.
Well, the thing about that is not something that I first of all, I don't want to accuse businesses of not
I'm
cleaning.
Just saying. I'm not.
So I don't know what they're doing. I don't know, but
I'm just seeing a lot of pictures that seem really weird. That
right
from a health standpoint,
and that's actually enforced by DOH, not DOT.
Right.
DOH enforces
and special enforcement, right?
No, DOH enforces restaurants, Department of Health. They're the ones that do the inspections. They're the ones that are going to make sure that the restaurants are following the rules as far as COVID and distancing and that sort of thing. That's all. That's DOH.
Hi, it's Pauline from DOH. It's actually a combination of our agencies. So the mayor under the Office of Special Enforcement has pulled together inspectors from all agencies. So any agency that has an inspector force has been tasked with enforcing COVID-19 social distancing regulations across the board.
Oh, okay.
Yeah, but when it comes to actual restaurant food safety inspections, yes, that continues to be Department of Health inspectors who do that.
Pauline?
Sorry?
I should probably hold the question until Steve is on the phone when you're doing your presentation. As much as I want to ask you questions.
Yeah, of course.
The agencies are DOHMH, Mayor's Office. The coordination is coming out of what? Mayor's Office of Special Enforcement?
Yeah, so the Mayor's Office of Special Enforcement is coordinating all of the other agencies' inspectors, and they can include folks from obviously DOHMH, DEP, DOT, DOB, FDNY, NYPD. So any city agency that has inspectors who are now trained to do this type of work can be deployed for any social distancing complaints.
Now you're DOHMH, right?
Correct, yes.
Okay, so I heard a rumor, which I'll say before the meeting is recorded. The rumor is that y'all are actually doing all the work for HH Health and Hospitals.
That's not that's not 100% true. I think there's
like 90%?
No, I actually don't know the breakdown, but I do know that
Sally, you're stirring the pot.
I didn't realize you guys were
Sally, we haven't even got going yet, and she's already. Oh my God! Like I got a headache already. got some ibuprofen. Oh my God. Like,
That is
I got
so
something better. I got
Jesus,
chocolate. I got chocolate.
like-
Ooh,
Yes,
chocolate.
a new shirt.
oh my.
Everything is backwards. Love is the way. It's at the cathedral. They make two shirts that I love. This one and the one that says, "Oh my God."
That's
I
right.
wore it to a church across the street from me. I'm Episcopalian, but it was a Catholic church, Good Shepherd. And boy, did I get some flack. People telling me it's sacrilegious. And I thought it can't be sacrilegious. It came from the shop at the Cathedral St. John the Divine. I love their swag. I guess it's not swag since it's not free.
Pauline, do we get a child sighting today?
You might. He's stuffing all of his cars into my pocket at the moment. I have no idea what's happening. Rocky, do you want to say hi? Yeah. Say hi, come.
Aw.
Oh,
Say
hi.
Cute.
Good smile.
So cute.
Really? Did you used to be two? And then you added one more?
Yeah. Okay.
That's so cool. If you're playing Jen, he's gonna be out before you are. And there's our Steve right on time. Yay. Boy, this is great.
What's our quorum, Steve? I forgot. You're muted.
Is Steve there? I thought he stepped away for a minute.
Yeah,
I
he's there.
thought-
He's just muted.
Oh, okay.
Now he's not, there he is.
Can you see me?
Yeah.
Now we can. Yes, now we can.
All right, I'm within the frame.
Yes. You're
Yes.
far away though. Why are you so far away? You don't like us?
No, I'm afraid what you're gonna hit me.
Oh no.
All right, did you see the reso I sent a few minutes ago?
No, but I can look for it.
Okay,
Yep, got it.
okay, where's my, this is not my list. What the hell is this?
Oh.
Okay, is Betty here? Tanya's here, Daryl's here. Catherine? Naisha? Sally? Barbara? What is this?
Naisha is here. I see her name and I'm here.
Naisha is here.
Yep. She's
Jay
muted.
Mazer?
Yep. He's muted.
He's muted. You'll marry Smith?
Oh.
She's no longer a public member for your committee. She resigned, actually. She's not a public member for any committee, no longer.
Oh, okay. All right, so that means we have 10 members. We need 6 to make a quorum, and we now have 6.
Yay.
All right, to Tanya, Daryl, Naisha, Sally, and Jay.
And you.
Oh,
What was that?
cool.
Oh, cool, okay. Paola, did you get the resolution that I emailed just before 7?
Yeah, I saw you send it to everyone.
Betty
Do you need me to
Lehman is
resend it?
here. She's under attendee. She needs to be promoted.
Oh, yeah, she should be promoted.
And given a raise too.
Yeah.
1, 2,
She
3,
just
4,
got
5, 6.
promoted. Yay, Betty. You deserve a raise too, said Daryl.
Okay, all right, so then we're up to 7. All right, is Mark Levine on the call?
Not yet.
Doesn't look so. No.
So Steve, you have a view. I don't know if you're logging in through your phone or through a computer, but you have a view where you click on participants and you can tell who's on your stack. So you can tell who's on the call.
We
Oh,
have
okay,
4
let me try.
attendees right now. Cheryl Miller, Jazio Montes, Maria Garcia, and Nancy Preston.
That's all?
So far, it just started, Steve, and they're used to it not starting necessarily on time.
There's other entertainment going on tonight.
Which
Like
is
what? Oh, you mean the
Constantly
incident that's-
looking at numbers for
Oh
the.
God, I can't.
Oh,
Oh
no.
gosh.
I heard there was
Oh,
an election on
We
Tuesday.
counted another 10,000 stack. Okay, great. You know, like seriously.
was great. Gary May, Georgia, come,
Yes.
baby.
Ugh.
All right. All
Count
right,
it
what-
already.
Can I ask you all a question? Who is the picture behind you? That
Who,
woman?
me?
Oh, I
Okay.
asked him the same thing.
The picture
Oh.
behind you, is that your mom?
That's my mom. Yeah, she would. That's
She's a
she had that
beautiful woman.
painted for her parents, my grandparents, when she was 18,
I love that picture.
and it was apparently under the stairs in my grandmother's house for 30 years, and we found it when we were cleaning out her stuff. So,
Oh,
yeah.
by the way, I'm wearing double glasses in case anyone needs to ask. Because when I try the magnifying glass, it makes my face make one of those like balloon things, the gross things my son used to do on like Apple. And I can't stand that. So apologies, but my eyes are getting worse and I haven't gotten them.
All right, I'm calling the, hello?
Yeah.
Calling the meeting to order at 7:05. We have a long agenda that we have to get through. We're going to be joined, I guess, at some point by Mark Levine, who's going to tell us about a lawsuit that he's joined as a plaintiff suing the federal government over its response to the COVID-19 crisis. So when he joins the call, we'll let him start speaking, I guess. Pauline, you want to begin?
Sure. Hi, good evening, everyone. So thanks for having me back. As you know, cases across the city we are seeing increases in certain neighborhoods. I looked at your data on our website and it looks like 10033 and 10040 over a 2-week course have a slight decrease in cases. And 10032 and 10034 have a slight increase. So, I mean, I think the whole issue is it ebbs and flows, right? But the point is we are encouraging everyone to go get tested, to maintain, the core 4. Again, we really want that messaging to be out there. So if you need anything from our end, posters, palm cards, things like that to share with the community, please let me know. If there are any organizations on the ground level that work with, disenfranchised populations, immigrant populations who maybe don't really trust the government, elderly folks who don't have access to the internet, any of these folks who really need to get this information and still haven't, please let me know, because we would love to be able to find some way to share this information with everyone. Again, thank you so much for a member of your board who continuously sends me some problem locations. I forwarded all of those over to the Mayor's Office of Special Enforcement and the Community Affairs Unit so that they can send out inspectors to inspect any type of social distancing violations. So again, just to be clear, when it is a social distancing violation, the Mayor's Office has a task force under their Office of Special Enforcement to go and send folks to those locations. Currently, they're at a capacity working at those specific locations in Queens and Brooklyn, but they do send folks out to spot check locations that have continuously popped up as being problem locations. So please, I encourage you to continue sending those to me, continue calling 311, just letting us know what more we can do to get this messaging across to folks, because we do know it seems as though there might be a pandemic fatigue where people are a little bit tired of doing all of these things. So, maintaining social distancing, staying home if they're sick, wearing face coverings in public and also indoors. If you are in a location that is not your home and you are with people who are not your immediate relatives or who live in the same household as you, you must wear face covering. So all of this information is on our website. We continuously update our website with information. We are coming out with guidance for the holiday season, so please look for that. I will definitely send it over to the board as soon as it's up. It'll be translated into multiple languages, and of course, we're more than happy to come and speak to groups that want to pull together a group of people before the holiday season, just let me know, and I'm happy to speak with folks on that. But I want to turn it over to Laureen from H&H Test and Trace, because she has a lot of really exciting things that they're doing on the ground level. I know our Action Center has been passing out face coverings and working with local CBOs and things like that to get resources out into the community, but I think Laureen has some really exciting news to share as well. So I'll just pass the floor over to her, and happy to take any questions. Yes.
Pauline, before we move on to, is it Lorraine? Let me ask you something. I was, I guess, tagged on Facebook by somebody who's concerned about these outdoor restaurants that have, they've set up like tents, see-through tents around the table. So everybody is within the tent, sitting around a table, and they're not necessarily family members, but the concern is that it's a closed space where aerosols could more likely be transmitted. Is that a source of concern?
They might be gone.
So all of these structures should be approved by the DOT if it's for outdoor dining prior to setup, or after, after they set it up, they need approval before they can allow patrons to utilize that space. And so if you see a location of particular concern, I would recommend, checking in with the DOT to see if they have the proper permits in place. But I think as long as it's open on one side, like there's a large opening, I believe that that's within the state's guidelines and regulations. And so that's okay. If there's like one tiny doorway and a completely enclosed space, so like a sidewalk, enclosed sidewalk cafe, that would not be something that would be allowable on the street. And also, if the tables are far enough apart, 6 feet apart, I think that would be within regulation as well. So I think a lot, they have to get approval before they're operational. So, but again, if there is one particular, a couple of particular locations of concern, definitely, reach out to DOT to see if they have the proper permitting in place for their restaurant.
Yeah, and it looked as though there was just like a flap as an opening. It didn't look as though there was a very. It didn't look as though there was any ventilation.
Sure.
I think, Steve. Can I talk? Can I?
Yeah, go ahead.
Okay. I think actually, when I was driving back into town on Monday, I saw some people standing with someone outside at those pods as we made the turn, and I think the pods are gone. I mean, those bubbles are gone. But they're building out onto the sidewalk with tents that are basically turning outdoor space into indoor space. And I'm not sure how that's being regulated. It did come up, I brought it up at Traffic and Transportation, since the Open Streets, Open Restaurants is a DOT program. And Debbie agreed that I guess it's up to Eleazar per the bylaws to figure out what to assign it, but maybe we should have sort of a town hall addressing, or at least the committee should have a conversation, probably health and environment, traffic and transportation, business development, and maybe licensing.
Well, if this is a health issue, I don't think we need to wait for a town meeting to bring it to somebody's attention.
I think it's a big issue. And as long as we know the proper reporting. I did have a question for you, Pauline, a separate question. I know you said the numbers were down, but I think I saw a Patch article saying the numbers were really high, maybe week over week, since the beginning. They were really high in 3.3. There were 40 more cases in 3.4. I can email you that article, but it seemed to be that we were actually having a problem, that we had bigger increases. I can see if I can find it now, but
Sure. I mean, from what I just gathered from our website, in 10033, there was a 12% decrease in cases. But I mean, there's also, sorry?
I guess it depends on what day of the week, because they were increasing by like a full percentage point in sort of testing results.
Yeah, I mean, and also I think a lot of confusion lies around testing rate also, per 100,000 residents. So I think a lot of a lot of that data is may cause some confusion, but again, you know, things change week by week. I think if we're not seeing a steady dramatic increase in a neighborhood, I think that's good. But I think whenever we see some small incremental increases, we do want to put resources into the community and make sure that that stops before it becomes a big problem. So yes, absolutely. I think we are focusing on your district. So Washington Heights is not like a hotspot location right now, but we are seeing some incremental increases, which is why I think, you know, our Health Action Center and Health and Hospitals are doing some on the ground work in your district. So
Two other things quickly. One is I would be interested in the palm cards, et cetera. So I will reach out to you. What
Sure.
email is best to use?
So my email is P and my last name Ferrante, FERRANTE @ health.nyc.gov.
Great. And then the last thing I wanted to bring up, which also would impact Lorene's, is I guess effective Wednesday of this week, there's a change in guidance for travelers. It used to be you don't have to test, but now it looks like they changed it to anything that's in a non-contiguous state or location. But you can opt out of the 2-week quarantine by getting 2 tests, one maybe there and one here. And I don't know if you could get one here and another one here, but you know, I don't know where I would have gone in DC to get tested, and I would feel more comfortable getting tested where I continuously get tested. You know, the day I come back and then 4 days later. So I'm not sure how that works, but I know that the governor's guidance has changed, and it's a fairly significant change.
Yes, you're right. It is it's a state change in guidance. So I believe that if you do have 2 tests that are negative, you can, you know, not have to quarantine for the 14 days. I don't know the specifics. I apologize off the top of my head. But I can try and find the link to the guidance and I can send that over.
Right. And also, I just wonder if you're sort of caught in the middle, because now one can't even go back and look at what the guidance was before the 4th, at least on the governor's website. I have gone on the website, so I know the new guidance.
Right.
But I wanted.
Maybe Sally, I think maybe
Yeah.
we could get the state Department of Health next time for questions related to that.
Okay.
I just did have a quick question, which was similar to a question in the chat for Pauline.
Yeah.
Just about, you know, if there are stores or restaurants that we see aren't complying, you know, with, you know, the mask thing, then is 311 still the best way to report those places, or are there
Yeah,
other?
so 311 is definitely still the best place to report that. You can also just send me an email at the same time or with the 311 complaint number, and I will be sure to reach out to the mayor's office so that they can let their team know. And then if it's a restaurant that serves alcohol, I think you should let the state know because they have the arm of the State Liquor Authority. And I think the State Liquor Authority and I don't want to be punitive to these restaurants, right? Like they've had a really difficult time of it. But if they really are contributing to, you know, people not following any guidelines, I think they should be educated a little bit more. But then if they continue to be bad actors, right, the State Liquor Authority should come down and sort of have a good talking to them about what is right and what's wrong. But I know that the governor was pretty, like, you know, pretty committed to having the State Liquor Authority revoke liquor licenses. So if that's something that you think that business might need, I would recommend letting the state know as well.
I think a lot of it, like.
Sally, let me get in here.
Cheryl, you can, yeah, go ahead and type your question if you want, Cheryl.
Yeah.
Just answer.
Yeah, but Pauline, I just want to make note that since this committee met a month ago, there have been 428 cases in our 4 zip codes, 4 additional deaths. I mean, zip codes 32, another 140 cases, zip code 33, 126, zip code 40, 69, zip code 34, another 93. So I don't know, seems as though Seems as though we're not doing that well.
I mean, based on population size, I don't really know what your population is for your zip code, but I mean, any case, right, to us is sort of a case for concern.
Yeah.
But I think, just to be comparative to the other locations where we're seeing huge hotspots, I mean, they're at like a 5%, 8% positivity rate, whereas you guys are not anywhere near that. So I think all of Manhattan at this point is still pretty much below that threshold. And so,
But
I know
in the-
it's not any comfort to you. I know you want many, many more resources available to your constituents and to your district. But I think we're seeing some real problems in other neighborhoods throughout the city. And so a lot of
Right.
the focus is on that. But you're right, like we don't want to get to that place in Manhattan.
Well, for the most part,
could avoid that.
for the most part, we rank in the middle. I think there are maybe 177 zip codes, and zip code 32 is number 79 on the list. Zip code 40 is number 80. The zip code 33 is number 91. The zip code 34 is number 120. So we're far from being at the top of the list. We're being in the worst category. But in the last column on your chart on the table on the DOH website, it says that 3 of our zip codes have a 9% positivity percentage, and zip code 34 has 7%. So isn't that fairly high? I can't hear you.
Sorry, I muted myself. I didn't see that on our website, so let me go back and check. Because if that's the case, yes, it is pretty high, but I don't know what's contributing to that number, whether or not it's based on rate, which would be. So let me go back and check.
Okay. Let me know what that signifies.
Because if it were that high, then it would have automatically triggered something within our agency to say that this location requires a lot more attention, and that hasn't happened yet. So, but let me just double check for sure.
And a lot of the zip codes seem to be very high. They seem to be way over the 2% or 3%. They all seem to be somewhere in this range. So I'm just trying to figure out, what does that percentage really represent?
Well,
Yeah,
I just wanted to jump in, Pauline. Sorry. My name is Laureen Valentine. I am the Borough Outreach Director for New York City Health and Hospitals, specifically for the Test and Trace unit. I've just been helping my colleagues over in the Bronx, but now I am completely focused in Manhattan. I joined Pauline at a community board meeting just last week. I worked at some of the polling sites this week in East Harlem and in Washington Heights specifically. And so I can tell you from the city's perspective, over at Health and Hospitals, we do not have not even a 2.0 or 2 and higher positivity rate in Manhattan. My job specifically right now is focused on prevention so that we can keep the numbers down. Work with all the community-based organizations within your community board in an effort to partner and provide access to PPE, give you microsites where folks could get tested for free or low cost at no cost in your area, and to hopefully work alongside with you so you can be conduits to your community to disseminate information. So I think Mr. Simon will go back to our colleagues and our departments to verify that information. But as of this morning, every day I do my daily team calls. Those numbers are surprising and shocking for me, specifically since I'm tasked with Manhattan, and that has not come up.
Well,
for us.
they must represent the percentage going back to March. They can't be like the current testing. It doesn't make any sense.
Exactly.
It just even if we're talking about going back to March, I was surprised that they were as high as that. But that's the only thing that would make sense to me. I mean, how could they possibly be that high right now when, as you say, we're under 2% and maybe even under 1%?
Yeah, and the only zip code that I had in Manhattan that was on our watch list, which as of Monday came off, was in East Harlem. And the minute it went on our watch list, the very 12 hours later, I did an outreach program in East Harlem right away and had a Canvas team out there.
Okay. I mean, well, I mean, I'm I got to believe we're not in a severe critical condition at the moment. But I was struck. I just trying to, if Pauline will go back, she'll figure it out for me, and she'll tell me what those numbers represent. But we definitely want to establish an ongoing working relationship with you, and want to support your efforts, and want to make sure that people in Washington Heights who wish to get tested can find an easy way to do so, and hopefully get their results back pretty quickly, as rapidly as possible.
Absolutely.
Can you post, I'm sorry, can you post the links, you and Pauline, to the links to the websites that you've been sharing with us? If you could do that, that'd be great.
I'd love to,
everyone can
only
see what this
I don't have the chat feature available to me. I guess as a
we don't
panelist, but I
either.
can.
That's-
Okay,
can-
so I can
you can-
definitely send an email with all the resources I have available to you
Right.
folks, and
Yeah,
so that you can send it out to the entire community board. Absolutely.
That'd be
Perfect. Perfect. You could send it to me, or maybe you now have Paola's email address.
Yes, I do have
Okay.
Paola's email address,
Okay.
and I'd love
All right,
to.
so copy me if you don't mind, and we'll send it around. And would you also want to join us on a regular basis as Pauline does?
Absolutely, if I'm allowed, absolutely, I'd love to do that.
Well, I mean, I would allow you. Who else has to allow you?
Thank you so much, Mr. Simon.
Okay. All right. Is there anything? Is there
Sorry,
anything-
Steve. Yes, I just checked our website, and what the number and percentage you were talking to were cases from March. So
Yeah.
that's a total overall from March until now, a 9%. Yeah. So that's the number. So I would trust Lorraine's daily
Okay.
count
Okay, good.
because she probably has the best information.
Right. So, I mean, Lorraine, do you specifically know what our positivity rating is in Washington Heights and Inwood? Are we? Do you know where we are?
So I don't have a specific number for where we are in Washington Heights or and Inwood, but since I've onboarded for Manhattan, it's been on my watch list. I've actually already partnered with a social Dominican club in Washington Heights, and I'm reaching out to elected officials as well in the area. I've joined the community affairs unit, my colleague Isaiah Jenkins. And I and Pauline actually are working on something that we hope to get some information to you early next week, where we're planning a joint virtual health seminar prior to Thanksgiving, since we want to get in front of things. We're very hopeful that folks will be vigilant. But as Pauline had mentioned, there is this COVID-19 fatigue. People are tired of hearing wash your hands, wear your mask, social distance. However, some new information that we've come across is that the uptick in numbers or an increase in positivity rates are due to small family gatherings, not the large family gatherings, especially in enclosed spaces, which is why we're trying to get ahead of things and possibly have a speaker and an expert on there. Once we've confirmed that prior to Thanksgiving, we'll roll that out to you and an invitation to everyone on this community board, along with some other folks in Upper Manhattan, so that we can work together in order to prevent a second wave.
And are you also working with the Northern Manhattan Improvement Corporation? A couple of their resource navigators gave us a presentation, maybe it was 2 months ago, and they apparently supplement the work of the Test and Trace Corps by providing assistance to people in isolation. They're not actually doing the tracing, but I guess once you identify them and people are placed in isolation, they then come in and provide support services for the people in isolation, make sure they get food and medication and any other assistance they need. So I would hope that you're in close contact with the people there at Northern Manhattan Improvement Corporation.
Well, I'm not sure if it's Northern Manhattan Improvement Corporation, and I can check for you, but we definitely do have a Take Care program that's kicked off, and tomorrow we'll have our new communication pieces where we're going to disseminate to the public. I would absolutely send that to Paola and yourself as well, where we'll have information on the hotels and the food that we're providing to folks who aren't able to quarantine at home. And do need assistance with quarantine. There'll be free Wi-Fi. Folks can hold on to their phone or devices while they're there so that they can stay in touch with their loved ones as well. We've had a lot of folks asking for detailed information on this. I myself haven't been able to see the information yet. I'm not privy to that. So we'll have tomorrow, they'll be displaying that to us internally, and then we'll be disseminating that to the rest of the community.
All right, well, keep us in the loop.
Can
Sally, you have a hand up?
Oh, okay, then I had a question.
Okay. Sally?
You're muted.
All right.
Yes, I posted and it's under answered questions, the patch article. The reason it caught my eye is the picture that it had with the article were two people with masks on in front of Coogan's, which I thought.
Oh, yeah, I saw that. That's right, yeah.
And that's where the positivity rates were. It said the rates in all 3 zip codes. For some reason, they only did 3.2, 3.3, and 3.4. The
Right.
positivity rate in all 3 showed an increase from the previous 4-week period. This was for the period ending October 24th. The most recent overall COVID test shows significant jumps across the board. And I guess that the data from last week was 67 zip codes around the city were above 2% over the 4 weeks, according to Gothamist, which reported the data.
So it says that 3 of our zip codes were above 2%?
I'll give you significant increases, and I will tell you what they were.
It doesn't say what they were.
It does. That's why
Oh.
I'm just scrolling down. Okay.
Yes, I am aware of this article as
Oh,
well, and
please.
it's caused a little disarray for the Gothamist versus the information that we're actually receiving at the Department of Health and the city from the testing sites, from the locations, from the hospitals that report back to us. So there seems to be two different sides. The Gothamist has theirs and we have ours, and that's not something that those are not the numbers that we've seen. So I can't speak on the Gothamist numbers, but I can speak on behalf of the city and say that that is in fact, for us, that is not true.
Okay, should I give you the numbers that they reported in Patch?
Yeah, what are they?
Positivity rates in 1033 was the highest. It was 2.01%. In 3.2, it was 2%, and in 3.4, it was 1.7%. And then they gave the and that was out of 67 zip codes around the city were above 2%, and 16 were above 3%. Only 20 zip codes in the month prior, only 20 zip codes had rates above 2%, including 8 above 3%. And then the number of cases, they said, in 3.2, most recent 4 weeks, 104, and these are the weeks ending October 24th. 10032 had 104 positive cases. In the prior weeks, it was 41 cases. 10033 had 98 positive cases in the prior week.
I'm sorry. Maybe you could just post that in the chat and we
I
can.
did.
put it
I
in
not
the-
in the chat. I answered
Yeah,
Cheryl's question. So if you go under
Okay.
answered, the article is
All right.
there.
All right, but
question.
meanwhile, 1 second, if Patch is saying that our positivity rates were basically 2% or lower, so that doesn't seem to be a problem. I mean, if that's what they,
We
I mean, if
want to
that's
be
what they
below
were.
2%.
what?
I think the idea is you want to be below 2%.
Well, but we're not very, in one case, we're at
In
2%.
line with the city, but the city is too high. If these numbers, as Lorraine said, if these numbers are any good, because wasn't above 2% was like the same cutoff they use for schools. If the rate went above 2%, then we're closing the schools. So Steve, 2% is a very significant percentage, which is why the accuracy of this data is essential.
You're right, Sally. As soon as a zip code or a neighborhood gets identified at 2%, it becomes on our watch list. And we start a strategic plan. You know, Pauline would get hit up right away, all kinds of folks within the agency, and that becomes a primary focus for the next 72 hours.
I would like some of the swag, you know, the palm cards and stuff like that, because I see a lot of it in the park and I can hand them out, and I'm always in the park. So I'd be really happy to do that, and I could do it at the farmers markets, and I'm happy to walk over to Dykeman houses and do it over there. Anyway.
But Lorraine, you're saying that that according to DOH records, the Patch article is not accurate when they say that the 2 of our zip codes were.
Well, I can't speak on DOH. That's where Pauline comes in. I have to be very, very careful about that line, but I can speak on behalf of the city. Yeah.
That's
By
what
the
I
way,
meant.
Mark Levine is here, but he changed his name to K. Smith.
Okay.
So Lorraine, just quick question. What is the role of the sheriff's office in what you all are doing?
I'm so sorry. I have to get back to you on that. This is the first time I've ever been approached with that question.
Oh, okay. I guess maybe it's not. I'm pretty sure it's yours, because I saw people at the airport recently. I was in Texas, and they had the trace and.
Yeah, there's several units in Test and Trace. You're absolutely right.
But now I'm getting texts from the sheriff's office about it. I'm like,
okay.
What is this?
So I'll find out tomorrow. We're on a call with our entire team. My unit specifically deals with outreach and specifically with outreach within the community in the city of New York.
All right. It looks like we have 2 other hands. One is K. Smith. Is Mark on the call?
That is Mark.
What?
I am, and I apologize. This is Keisha Smith, my scheduler, whose name is appearing, and I'm trying to change it on the fly. I apologize, but it is.
No, that's all right. So, did you have a question for Lorraine?
Well, I can clarify this dispute on the data if you'd like.
Oh, okay.
Which is that unfortunately, what's available publicly is pretty delayed. We have a view over the last month. It's a 4-week average, and it's a week old when it's posted. And those are the numbers that the media is citing. And they do indeed show rising positivity rates citywide in Manhattan and specifically uptown. And so many of them were at or above 2% a week ago. Those numbers have been updated today, and they are a couple of them are slightly better, and a couple of them are now worse. It looks like the one that's worse is let's see, 10033. So 10033, the positivity is now 1.93%. 3.4, it's 2.47%, which is worse.
Wow, 3.4 is horrible.
4.0 is 1.17, so that's better. And I don't know if I just said 3.2, it's 1.74. These are obviously much lower than what you're seeing in states around the country where the virus is serving, much lower than what we faced in New York City back in the spring. The concern is really the direction that we're going in. And we have had a slow and steady increase. Most of these have doubled in the past month, really compared to mid-September. The number of cases has more than doubled. The positivity has roughly doubled. And all that was before the weather started to get cold. And the cold weather means, I don't know if it was Pauline, I'm not sure who was speaking about it, but it's going to push people back inside. And we've been living life in our parks uptown. I mean, birthdays, weddings, family reunions, yoga classes, not to mention outdoor dining. And that's been the safest place to be for the spread of the virus. And, the data we're seeing reflects that period when it was warm. We had a very, very warm fall. And now it's getting colder, and I'm sure you've all seen it. The parks uptown are much less full. Where are those people now? Well, probably inside. Are they wearing masks when they're gathering? I don't know. I worry. Anecdotally, I've heard not necessarily. And what we've seen around the country is that what's driving this is small gatherings inside, sometimes with family, with close friends, where because it's not a lot of people and it's people they know well, folks let their guard down, and the virus spreads that way. And we got to be worried about that uptown. We live in small apartments, and this is going to be a tough 2 or 3 months while the cases are increasing. The vaccine's not here. We still have horrible leadership at the federal government, which I'll speak about when you cue me, Steve. But we have to be really vigilant now. It's going to be a challenging couple of months.
Can I ask you a question, Mark?
Sure.
And maybe.
Well, Vice Chair, before we go to Mark, I want to make sure that.
It might be Department of Health, and it might be Lorraine has his number.
Yeah, well, I just want to make sure. Look, can I go back to Lorraine? I want to make sure Lorraine is finished with what she had to say.
Okay, sure.
Thank you so much, Mr. Simon. I appreciate it. So really quick, I think Councilmember Mark Levine really hit it on the nail there, where folks, as I mentioned earlier, you know, we're trying to take preventative measures and help folks as we approach the holiday season, right? We want to be respectful and responsible for folks. So one of the ways in which Test and Trace would love to partner with you is to help us promote the basic 4 core that the city's putting out there. And I'll email you our digital palm card. And we have that available in different languages. Promote nearby testing sites, which I'll also email to folks according to the zip codes. Distribute palm cards and masks. So I'm not sure if there are community-based organizations in the neighborhood or centralized where we could actually, you know, send cases of mask and palm cards, and folks who don't have access to that can actually pick up. Organize days of actions for nearby testing sites, handing out flyers, masks to drive traffic to sites, materials to be provided by us from Test and Trace. So really would be a special day where you would promote getting tested. And if there aren't a community-based organization that is doing this or willing to do this, you know, if folks want to host, if there are community-based organizations that are willing to do this, if they want to host a microsite, maybe if there isn't one in a neighborhood, for instance, if seniors have a hard time accessing it because of the terrain, the turf that you guys are at. So H&H staff would bring self-test kits for people to test themselves, and folks will receive instructions for how to get their results. Those are some of the ways that, you know, we're looking to get ahead, in addition to possibly coordinating this virtual health webinar.
I'll do 10034. More than happy to.
Okay, this is Barbara. I have a suggestion. I'm on the board for the Star Senior Center. I also was in touch with the YMHA on Nagel today, and both senior centers are in the process of looking for, in the near future, starting grab and go senior lunch. They won't have a sit down lunch, but they are doing outreach and hope to begin soon grab and go senior lunch.
That's a perfect way to disseminate information. Absolutely.
Yes.
Mask and palm cards as they're giving out. Yep.
Palm cards, and maybe even set up a micro testing.
And what about the food pantries that are giving out food?
Yeah, that's another good point. And
Yeah,
also
absolutely.
the recycling houses, the
But I
farmers
do
market.
point out, more so than the food pantries, the site at the Y and the site at the Star Senior Center have the room and the space for a micro testing site and a good way to do the distributions.
Well, that's definitely something that we can talk sidebar about, if we can get that information to Paola and Mr. Simon, so that we can continue this conversation. I'd really love to connect with those folks, you know,
Right.
so I can see if it's available, but at least to see how we can start disseminating information at mutual aid sites as well.
Yeah, it's
Well,
not
let's,
yet, but soon they hope to. Not
yeah,
yet, but soon.
Betty, are you on the call?
Yeah, I am. I wanted to say that, just to add on to what Barbara said, all of the senior centers are supposed to start grab and go. And ostensibly, the date was initially November 9th. I haven't heard about any changes in that date, but one of the things we can do is check to see if that's the actual date or if it's been pushed back. It has been pushed back a couple of times. Richard, you might know. You got on mute.
Last Friday afternoon, the Department for the Aging sent a directive to all senior centers in the city that grab and go and all on-premises activities, including grab and go, do not go forward at this time.
Oh,
It
no?
was, as was just mentioned, targeted initially for November 9th. It's not happening with a new date not in place at this point. It appears that the guidance came initially from the Department of Health on that.
Oh,
All right.
oh, all right. Well, that's too bad. All right, but,
The food,
but certainly when it comes time, if they start it up, Betty, maybe you could help put Lorraine in contact with all of the people through the Council on Aging?
Yes, I can help. And yes.
All right, very
Glad
good.
to help you, Betty.
Okay.
And Richard is runs a senior center in Central Harlem. He can
I'm in
also-
Harlem, but it's part of the longtime Washington Heights organization, ARC Fort Washington.
Right, right.
I might add, in terms of numbers, in my conversation with the Y on Nagel today, I was told that they have about 1,000 seniors on their active list.
Yeah.
So that's, which means that they come in for the lunch, the regular contact, regular activity. So that's a good number for just one center.
Well, plus of course, the Y has a whole variety of, in normal times, a whole variety of intergenerational programming. So
Yes.
they reach a hell of a lot of people in the community beyond just seniors.
Yes, much more.
so maybe we should just send all our suggestions to Steve.
Yeah, okay, and I'll pass them on.
I have a burning question, and I'm not sure who can answer it in the state, but I've got a lot of expertise in this room. In the same way that nursing homes have to report cases and deaths, where are hospitals reporting that information, hospital by hospital? I know that the New York Times had gotten hold of some of that data back in July, and they showed very disparate death rates depending on location. Like I think NYU Langone was the best, Bellevue was the worst, but even within the different hospital systems, there are widely varying rates of success, I guess. And I wonder if nursing homes have to report this data. I know there's somewhere that hospitals are reporting it. I just can't find it. And I wonder if you guys could be any help pointing me in the right direction. I know it would be
State Department of Health.
Yeah,
But it's not easily accessible publicly, not by journalists. And honestly, even the New York City Department of Health
well,
has
Mark,
to struggle for it.
yeah, I know it's impossible and it's critical data.
Yeah, actually, Mark, I would like to have a separate conversation with you about that question.
Yeah.
All right, is there anything else for Lorraine? All right, Lorraine, thank you for coming. I'm going to put you on the monthly list to invite you back.
And do you have an email address?
Sure. My email address is V as in Victor, ALENTIL, the number 8 at nychhc.org.
Okay, great. Thank you.
Thank you so much for having me. I really appreciate this, and I look
Absolutely.
forward to partnering, collaborating with all of you.
All right, well, rely on us for any help you may need, and let us know how we could possibly be helpful.
A day of action sounds great to me.
Yeah, well, let's figure out how we can.
River.
Right. All right, very good. All right, thank you, Lorraine. Thank you, Pauline. Mark, you're up.
Excellent. Great presentation, Lorraine. I want to emphasize that this fight is not over. And I'm really grateful to the CB12 Health Committee and you, Steve, for just continuing to focus on an issue which we're all frankly exhausted by.
We have no choice. We have no choice at all.
We don't.
You know?
But it's harder and harder to keep people's attention while the numbers are going up and up.
Yeah.
And I think the stats we shared momentarily ago tell the story, but this is not about hot spots in Brooklyn and Queens anymore. It's really not. It hasn't been for weeks. The numbers are moving up steadily in the borough of Manhattan. This is a citywide trend. Not, thankfully, the explosive geometric growth we saw in the spring, partly because we're still pretty good about wearing masks and social distancing, and that has put something of a brake on the rate of growth, but the numbers are growing. We're getting more people importing cases by traveling to and from other states. That's a real risk for us, and only getting greater as the virus surges around the country. We don't yet have a good read on the extent to which indoor dining is a source of spread. It's something we have to watch closely. But we know that the cold weather poses a risk factor. So in that context, Steve invited me to speak about an important legal effort I'm involved in, challenging the Trump administration, which, well, I've got one eye on the news sites, and boy, it's looking better and better for those of us who are rooting for Biden. I realize this is a non-political environment.
Yeah, please, no partisan activity here.
Exactly. Just reporting the news. Either way, the president is going to be Donald Trump until January 20th. And so we can't afford to lose another 2.5 months in the COVID fight. And I'm part of a team that has determined that the Trump administration is in violation of a law which I had known about before they approached me, the Pandemic Preparedness Act, which was passed in 2019. And it turns out to require that the Department of the Health and Human Services at the federal level share extensive data, collect and share extensive data about a pandemic with the public, and consult with local leaders in policymaking. And amongst the kinds of data that they need to help collect and share are testing and contact tracing. And so a legal team, which is headed by Norman Siegel, who I'm sure Steve knows and others know, has been a crusading civil liberties attorney in New York, ran the New York Civil Liberties Union for many years. He's been kind of the main legal mind on the team. And I've been brought in as a plaintiff in my role as chair of the City Council's Health Committee because of the ways in which this failure by HHS to live up to its legally mandated obligations has hindered my ability to do my job the way I should, because as a policymaker, like all policymakers, we have lacked critical data about this pandemic. I mean, my goodness, think about back in March, we were essentially drowning and barely knew we were wet because we had no testing data. That's on the federal government. But this is really about the next 2.5 months and trying to force H&H to finally do the right thing. And we have this case is being heard in Manhattan Federal Court. There's a public hearing scheduled. The first hearing is scheduled first week of December. The date is still in flux, probably December 2nd. I'll let you know when it's scheduled because the public can participate. They're all virtual now, so it makes it a little bit easier. But potentially the remedy could be a receivership for HHS if they refuse to comply. And I think the timing now is critical as we face a second wave in New York City and really a third wave nationally. And just the absolute requirement that we up our game now during these difficult 2.5 months. So again, this is the lawsuit. What I'll do, Steve, is drop a link. The Daily News had an article on it. That might have been what you saw.
Yes.
So maybe I'll drop that into the chat.
Okay.
And I'm happy to take any questions on this. I know you have a big agenda, but I do appreciate a chance to update you on this important legal action.
Yeah, appreciate that. Let me just ask you, that line you had a little while ago, back in April, we were drowning and barely knew we were wet.
Yes,
Is that your own line? Wait, that's
I
a
did
great
not make
line.
that up. I forget who I'm plagiarizing.
Oh, shit.
But
That's a great
I
line.
think someone at the, I think I got that from someone in the Department of Health. But
Okay.
I'm probably the first to say it publicly, so you're
Okay,
free
well,
to.
a good line, very good line. It's a
Thank
good line
you.
to steal. Okay, any questions? It looks like we have a couple of questions. Sally and Nancy Preston. Sally, go first.
I'm gonna pass my question that's to my hand from where can we get the hospital data question.
Okay, then take away your hand then. Okay,
Figure it out.
can Nancy ask a question? How do we let Nancy ask a question?
She either types in the chat or we promote her to panelist.
Okay. Then,
Do.
or Nancy, could you type in your question? Do we have it?
Why don't we just enable
yeah.
chat? I don't understand.
Yeah,
All right, go ahead.
Well, I think we should too, but
yeah,
let
I
her do-
agree. Chat should be-
other executive committee people.
All right, go ahead.
Did you promote her, I hope?
Yeah, Paola? Paola?
Nancy to panelist?
Yeah, what happened?
I'm looking for her.
You need what?
Nancy, we need you to promote Nancy Preston to panelist so she can ask a question. She's under participants, but not under panelists. So
Well,
we need,
Cheryl is also an attendee and she was able to type. I don't know if there's something, I don't know, on her side, but I will do it.
Yeah, go ahead.
hi, Nancy, unmute. Okay, she just needs to be unmute. She needs to unmute herself.
That she has to do herself. I can't do that for her.
Yeah.
Nancy, can you unmute yourself?
Oh, God. All right, all right. This doesn't seem to be happening.
Okay. Nancy,
Uh,
try and unmute yourself at the bottom of the screen, all the way, the bar, all the bottom bar, all the way to the left is the mute and unmute button.
All right, are there any committee members with any questions for Mark? All right, very good. All right, thank you, Mark.
Thanks, everybody.
And
Be
keep
safe
us
now.
posted on the progress of your lawsuit.
I definitely will. Thanks so much, Steve.
Yeah,
Bye-bye.
And the date of the public hearing especially.
Okay.
yeah. All right, very good. Thank you.
Thank you. Bye-bye.
All right, next up is Janelle Edwards from Columbia University Irving Medical Center. Janelle, are you with us?
Hi, good evening, Steve, and to the rest of the committee. How are you?
Okay.
Glad to hear that. So my report for this evening is very brief, and I just want to confirm that everyone is able to hear me.
Yes.
Yeah, you're coming through at my end.
Okay, great. Thank you. I know Zoom can be a little temperamental from time to time. So I'm just going to do a really brief overview of some of the activities that we've been involved with since the month of October. As some of you may already be aware, on the 27th of October, Dr. Barr gave a presentation to the general board meeting talking about COVID-19 and the local research that was being done at the medical center. He touched on a few important points that the pandemic continues to worsen. Even though the course is predictable, we do also know that public health interventions and options are effective and are available at our disposal. He continued to emphasize vigilance on masks, social distancing, and avoiding crowded spaces. And he also briefly touched base on the NIH-funded research that was provided in order to look at long-term consequences of COVID-19 on the lungs and on the heart. Another thing that I have to report on is that the current class of Dyckman Institute scholars has been selected. We expect that these hardworking students will be alerted as soon as possible within the next week or so. And then on the November 24th general board meeting, they will have the opportunity to be publicly recognized by the board for their academic accomplishments. Just a reminder, the Dyckman Institute Fund Scholarship is awarded to students in the Washington Heights and Inwood area who have applied to Columbia College and or the Food Foundation School of Engineering and Applied Sciences. So we're really excited about the work that these students have done, and we will take time to publicize their hard work and their efforts and acknowledge them and congratulate them. The last thing that I will be touching upon are our testing numbers at the medical center campus. And this is only at the medical center. I cannot report on the cases at the hospital. Through the last week of October 26th, 516 students were tested. One test came back positive. 699 faculty and staff members were tested, present company included, and one test came back positive. 77 other affiliates were tested, and that yielded 0 positive results. So that's just a really brief overview of the testing that's happened on the medical center's campus. And this information is updated weekly at covid19.columbia.edu, where we gather not only the campus data by cohort, but campus contact tracing, more information about campus testing, along with a brief snapshot of New York City data. And that's it for me.
Okay, so it was 77, you described the 77 people as affiliates, I guess. Those are employees, right?
Yes.
Okay. Okay, so out of all of that testing, only 2 people, one student and one faculty or staff member was found to be positive.
Yes, that's correct.
That's pretty good. Okay. All right, very good. Are there any questions for Janelle? Oh, very good. You get off scot-free. Okay.
I had a question, upcoming events.
What is that?
What's planned for November, December?
In terms of community outreach?
Yeah, and COVID outreach especially.
Well, we would like to have or invite a faculty member come in to speak to every general board meeting, just so we can cast a wider net in terms of outreach and, updating the community about the efforts that are being made on the medical center campus. Traditionally in November, we have done a canned food drive to support FYI's food pantry, but unfortunately this year we won't be partnering with them as their COVID-19 protocols do not allow them to accept in-kind donations, and that's a policy that's also been adopted by the medical center. So we're definitely still looking out for opportunities to support the community, to be a resource, particularly during this time. And I will, make the committee aware of any upcoming events as those become finalized, and I have the go ahead to publicize them.
And my other question is, are the medical students going back to clinics to do some work? Or are they basically just doing their one lab class and doing the rest of the stuff virtually?
As far as I know, the students have been allowed back on campus, but I need to get some more information about that in particular, and I can follow up if you are the committee.
Yeah, I'd like to, because I know a lot of them were really enjoying being in the clinics. You know, that
Yeah, it's an important part of their training as well.
Okay, thanks so much.
You're welcome.
All right, very good. Thank you, Janelle.
Thank you, everyone. Have a great evening.
You're going to email something to me?
Yes, I will.
All right, thank you. Okay, next, Betty Lehman. Betty,
Wait, I have a question.
who's speaking now? Naisha?
Naisha, yeah.
Naisha, go ahead.
Just, I don't know, just a general question. I don't know if people are aware of this, but I just found out that apparently there's been like shortages, or like community clinics have been closed down like significantly during COVID, and, or at least in a greater proportion than other healthcare facilities during the time of COVID. I don't know if this has been on our radar, but I think it'd be important for us to talk about this, or get someone to come in to talk about community clinics and ambulatory care services being shut down.
I'm not aware of that. Which ones are you referring to?
Well, just like programming throughout NYP campuses for ambulatory care services have been shut down, or like are still, not all of them are fully functioning, or they weren't functioning during COVID. And these are services that are critical for communities because they're community-based services.
Well, I think they may have shuffled some people around, but my understanding, we got a report in one of our earlier meetings, I believe that all of them were open. Would you be able to come gather any more specific information about this?
Yeah, I can gather some more and get back to you all.
Nice. I'll work with you on that. I'll help you out on that, because I know like a lot of the clinics that the medical students at Columbia were staffing, if they're not going out in the clinics, and those like Tuesday night clinics aren't going on.
Right, and just like more like, I just think that if we're going to talk COVID and talk about addressing COVID, we need to address it from a community standpoint as well as a health standpoint. And these are the clinics that are dealing with the community and people in the communities, and if they're not functioning, how do we expect to ever fully get it under control?
All right, well, let's gather some specific information so that we know what the right questions are to ask. So you're saying that these are Naisha, you're saying these are the hospitals' ambulatory care centers?
Well, they're all that in just different
care networks. So these are
I'm sorry, I can't hear Naisha.
Sorry. So these are like under the ambulatory care network. So these are satellite clinics programs that function in the community that are funded by or in part by New York Presbyterian. And just, I want to make sure that these programs and these clinics are open to the public and being advertised. Otherwise, our community is at loss. Like, we're losing out.
Right. All right. Well, I would want to know that they're not opening. That they're not open. That's news to me. Well, I'll just call them up tomorrow and find out if they're open. I mean, I can't, but it would be disturbing to hear that they're not open. I could understand maybe if some of the services were being centralized, which I think they were telling us at one point that they were moving some services from one location to another. But my understanding was that they were open. Well.
Right, but even if the services are being centralized, what communities are they being centralized into and out of, right? I think it's important for us to ask questions of who's losing services and who's gaining them if services are moved.
Okay, well, let me know what information you find out, and I'll try to make some phone calls as well. All right, Betty, are you ready?
I am. Okay, a couple of things. We are continuing to follow state and federal guidelines with regard to infection control, including the weekly testing of staff. All staff are tested every week for COVID. We are conducting window visits with family members and residents of Isabella And we do that, as people call in to schedule it, we manage to bring the families and the residents together for a period of 30 to 45 minutes and so forth. You may know from the recent media coverage, we actually had a wedding at Isabella a couple of weeks ago, not of one of the residents, but of the daughter of one of the residents. Actually got married in the courtyard of Isabella, and her mother was able to be at that wedding, which was really quite nice. It was covered by a number of media outlets, including Channel 7, Channel 4, and I believe New York 1. Anyway, I have an announcement. We have been operating the Resource Center, in fact, all of our community programs remotely since the start of COVID. And one of the things we had to take a look at was whether we were going to renew the lease at the Resource Center, which is on 169th Street and Broadway. And at this time, we've decided not to renew it because we do not know when this virus will subside and people will be able to return to a location. So we are going to not renew it right at the moment, and we're going to continue to have our staff work as they have for the last 8 months. They're working remotely. Part of what the Resource Center does is it speaks to residents with regard to benefit enrollment, as well as managing a naturally occurring retirement community right in that area. So we're going to continue to function as we have for the last 8 months, but not in that location. And that's it. I'm trying to see if there's anything else.
All right, well, I do want to mention that I've been checking the State Health Department reports about nursing home COVID-related deaths, and in the last month, there have been no additional COVID-related deaths at Isabella.
That's right.
That's important to make note of. Either
It's been that way for a few months now.
Yes,
So that's
either confirmed or presumed deaths.
Can I ask a question?
Yeah, go ahead.
Betty, do you have information on the number of patients you've admitted to the hospital and the conclusion of their cases, which hospitals they were admitted to, and what the result was from the beginning of the COVID epidemic?
I do not have that information. I know. No, I don't have that. I know the hospitals, we were directed by the governor way back, or whenever, in April or May, to not report any of that. That was the responsibility of the hospital to do that.
Yeah, we just can't find where they're reporting it.
Huh?
It's just impossible to find the hospital data.
I know what, yeah, I know. But,
Must be a very powerful hospital association in New York State.
no comment.
All right. Any other questions for Betty? All right, thank you, Betty. Are you going to email something to me?
I am. I'll do that later tonight.
Very good. All right, don't go to bed until you email it to me.
Okay.
Okay. All right, very good. Okay, this ends the COVID-19 portion of our meeting. Next is a presentation on the Columbia University Medical Center Community Outreach and Engagement Program by Andrea Reyes, Manager of Health Education and Outreach, and who at one point years ago was actually a member of this committee. Andrea, are you still with us?
I am with you. How are you all doing? Hi, Steve. It's been a while. Hi, Betty. I have some friends in here.
Yeah.
Steve, may I share my screen?
And you can share anything you'd like.
Okay, I just wanted to pull up a flyer. So I'm here to present just very briefly on.
Actually, 1 second before you go on.
Mm-hmm.
There's a hand raised. Someone named Gabriella. Is this Gabriella Estrella? No one raised their hand. All right, forget it.
Yeah,
all right, go ahead.
Here. Hi, this is Gabriella.
Oh.
It just promoted me to panelist. Hi, everyone. I'm Gabriella Basono. I actually was a former pediatric resident of NYP Columbia during the pandemic. And so I know that in regards, this is just a comment in regards to, I think it was Ms. Diaz who mentioned something about the clinics being closed from NYP. So I just wanted to clarify that there were clinics that were like pediatric clinics that were physically closed, but all of the patients, all the ACN patients were still being seen at the Audubon Clinic, either through telehealth or they were getting their vaccines and getting their primary care at the Audubon Clinic, and there were urgent care services available to them as well. I can't speak to what happened after I graduated in June, but I know that that was what was happening in the when they redirected us in the springtime. So just wanted to clarify.
But so you're saying though that the other ACNs, excuse me, on 181st Street and up in Inwood and the Farrell Center and the Wrangell Center, they all closed?
I know that the pediatric clinics were closed. I can't speak to the adult clinics,
right,
or the OBGYN clinics, but I know that the pediatric clinics, we were directing all of our patients to, we had like a central number, and we had nurses available. We had telehealth, we had all of our attendings working at the Audubon Clinic to see all of the ACN pediatric patients, but I can't speak to the adult or the OBGYN patients.
So that was at Audubon Avenue at 166th Street?
Yeah, that's the Audubon ACN.
Yes, okay.
Wait, I'm not only talking
I'm
about.
sorry, Gabriella?
Yes.
Tell me your last name?
Bisono, B as in boy, Isono.
Bifono, Bifono?
Yeah, Bisono, yes.
BIS.
I'll put it in the Q&A.
S as in Sam?
Yes.
ONO. And are you currently a pediatric nurse at the hospital?
No, I'm a pediatric doctor.
Oh, excuse me. Oh.
Gabriella, can I ask a question?
Yes.
Yeah.
Okay, so they were directed to the Audubon Clinic. Do you know how the census went up at the Audubon Clinic? I don't know, or the number of visits went up at the Audubon Clinic, or did it
I'm sorry, I don't actually know that information, but I'm sure they collected data on all of the cases that they were seeing.
Yeah.
The patients that we were seeing.
Do you ever find a way to help us mine the data? We would love to get some numbers.
Yeah, I'm happy to like redirect you to whoever might have that information.
There was also an article in the Washington Post about the number of children, I guess 100,000 or 200,000 being diagnosed with COVID.
I don't know the data on that. I'm sorry.
I'll send you the article.
Okay.
All right. Thank you,
Sally,
Gabriella.
Thank you, guys.
I have a question and a comment.
What
My
was
first
that?
question, I have a question and a comment. The first question, is Julio Batista on this call?
No, well, I don't think so.
Okay, because if we want numbers, we should reach out to him regarding that information because he should be able to provide that or gather it.
Yeah, well, the problem we have with the hospital right now is that they are refusing to provide us with any numbers. Every time we ask them for any numbers, they don't give it to us. So I have an issue with the hospital right now.
Specific to that hospital.
Secondly, I wanted to say that thank you, Gabriella, for bringing that up. But I wasn't just speaking regarding like healthcare services, right? Like I know New York Presbyterian is a hospital, but there's also other programming that happens that I think is critical in our community. And I want to know what the status of those programs are. It's great that our service, like healthcare services, were either done through telehealth or concentrated in one clinic physically. But I think we need to talk about other like community healthcare programs, like patient navigation programs, other programs for youth in the community, and how those programs are functioning throughout the pandemic and are still functioning, because I think those programs, again, are critical for our community.
Just to add real quick, this is Catherine. The navigation programs have not been shut down. I mean, they have multiple patient navigation programs and community programs, but those all continued via telehealth. And then on a case-by-case basis, escorting did take place, and it continues to take place.
Well, I think what we learned a couple of months ago was that the resource navigators at Northern Manhattan Improvement Corporation are still functioning 7 days a week. All right. Are we ready for Andrea to begin her presentation? Okay, Andrea, go ahead.
Okay, thank you, Steve. I'm just sharing my screen, so 1 second. Can you see what I pulled up?
Yes.
My flyer. Okay, so hi everyone. Steve, thank you for the introduction. So again, my name is Andrea Reyes. I am, among many things, a health educator at the Office of Community Outreach and Engagement, and which is part of the Columbia University Cancer Center. We are a team of really culturally diverse team of community leaders, cancer researchers, educators, and clinicians. We work to identify cancer trends in the community and address cancer disparities and work with communities in order to reduce those disparities. One of the things that we do are free community workshops for any community organization that wants to host us. I have workshops in English and Spanish. They are simple, easy to understand, very colorful, and get the point across. So they all have a cancer prevention and cancer risk reduction focus. If you see on the right, we have a list of community workshops I wanted to let you all know about. Nutrition, for everything from nutrition to lung cancer risk, HPV, preventing skin cancer, breast and prostate, colorectal cancer awareness. So all of the curricula start with, the identification of the problem. What is it? What is cancer? What is cancer in this particular area? What are the risks? How can you reduce your risks? We link people to care when they need it, and we talk about screening for all of those different cancers. I can scroll down because there's more. So this is basically who we are, what we're offering at this point. We are happy to take suggestions from different organizations. We were doing all of this work in person, and since March we have not, but we're putting on some really great workshops and webinars for anyone who wants them, basically. So I just wanted to let you all know. Is my information on this? Oh, no, that's the old information. So you can take down my email address, which is ar281@columbia.edu. You can write to me anytime if you would like to know more information, or you can ask questions now.
Well, you should email the presentation to me so I can send it around to the committee members. It's not that easy to read it all.
Yes, I know it's a lot.
But so what you're inviting us to do is to distribute the information so that community groups will know that they can take advantage of the workshops that you're offering, and you're able to offer them remotely at this point.
At this point, yep. And when we can come back in person, we will do so.
Okay, very good.
There's a great article in Cure magazine, Cancer Updates Research and Education, called Food Fight. Could fasting save your life? With special diets, cancer treatments could be more effective and tolerable. Good little article. It's a great magazine. You probably have it in your office.
All right. All right. Are there any questions for Andrea? All right. Very good. So, send me the presentation, and we'll send it, and I'll send it around to the committee members.
Will do. Thank you very much, Steve.
Okay. Thank you.
Thank you. Great to see you again.
All right. Stay in touch.
Definitely.
I love seeing the pictures of you with the boy and the dog.
That's all I do. I know. Thanks.
We're Facebook friends. Okay.
Yes.
All right. Next is an update from the Washington Heights Corner Project. Alexandra Moreno, the Program Innovation Manager, Adrian Feliciano, Director of Harm Reduction Services, and Executive Director Sam Rivera. They're joined by Gail Goldstein from the New York City Department of Health and Mental Hygiene. Alexandra?
Hello, everyone. Hi, Steve. Thank you for allowing us time to address the board today. I have a visual to go along with our presentation. May I share?
Go ahead.
Okay, I just need permission.
Sally, is that a new hand of yours or an old one?
Okay. Now, can everyone see?
I can.
Perfect. Okay, I'm going to hand it off to Adrian, our Director of Harm Reduction Services, to begin.
Yes, first, good evening. Thank you so much for having us here today. Really appreciate you taking the time to be here and to have us on the agenda for this evening. My name is Adrian Feliciano, and this evening we're going to be presenting on a proposal for a temporary solution for housing our program. So this is a presentation that we call The Village. And I would like to begin by introducing our team, our leadership team. Since June of this year, we have been under new executive leadership by Sam Rivera, who's actually with us now. Sam, if you'd like to take a moment to just introduce yourself to the community board.
Sure. Hello, everyone. I'm Sam Rivera. First, I want to thank you for allowing us to participate in your meeting. It was a pleasure to join a little early and watch the interaction and how committed you are to your community. I really appreciate that. So it just makes me more excited about the work we're doing and being a partner with you guys and everything we're doing. So again, I just want to acknowledge the commitment. I'm sure you know it because you live it, but to sit here and watch it was pretty cool, pretty amazing. So we'll make sure to tell everyone that they're being represented well. So I've been at the organization since June. It's been pretty exciting, but also very challenging. And it's really been a pleasure to be a part of the Washington Heights community. I'm born and raised on the Lower East Side of Manhattan. So I know many of the experiences that you guys are going through, we went through in the Lower East Side many years ago. So I'll leave it there. It's been a long night, and ask the team to continue the presentation. And I'm available for questions as well, of course, and I'll be happy to share my information with you all. Thank you.
Well, I just have to say that as someone who remembers the Corner Project beginning with one woman who I think worked out of her knapsack outside the bus terminal on Broadway, it's somewhat amazing to see that you now have 26 full-time staff. I mean,
thank you.
You may not have a location, but you have 20. You have 20. Well, you have a location. I get to install them, and you have the trailer. But I forget her name right now. But to think that what she started some years ago has now grown to 26 people. God.
If we grow it, they will come.
Yeah. Right.
Yeah.
Absolutely. Thank you, Steve. You can actually take, that's pretty much part of my pitch. But yeah, we started off very small. That was actually Jamie Favaro who started the organization, who founded us way back in 2005 out of the George Washington Bridge Terminal. And now we're compromised, or we're composed of a large set of staff that are led by Sam, Kaylin, and myself, who are co-directors of the program, and Alex, who is a program innovation manager. And we have public safety and outreach team, which is out collecting, syringe litter and engaging folks in the community. We have case managers who are doing linkage to care, HIV and hepatitis C testing, benefits and housing navigation. We have 6 harm reduction and syringe exchange folks who are front lines, meeting with our folks, educating them and providing supplies. And of course, our data and program management program. So to speak on all the programs, like I said before, our health services programming, which is really partnered and really strengthened by our partnership through New York Presbyterian and Montefiore Hospital. So through that, we provide intensive clinical care coordination, HIV and hepatitis C testing, as I said before, and community engagement, which I said before, which includes our syringe cleanup and public education on public injection diversion, which goes into our overdose prevention, harm reduction programming and support services, which is really a huge part of our programming. Drop-in services and hygiene services, which includes our respite care and day shelter, which has really been something that has taken an impact since we have lost our space. So just to go into it a bit, in 2018, as many of you know, we did lose our space, which forced us to shift our programming into the vehicles that we said that were mentioned by Steve earlier. And that really displaced our participants from the facility that we had. It was an 8,000 square foot facility. And it's really been reduced now to 3 outreach vehicles. And all of these services are crammed into those vehicles. So we provide the case management services, which has really fallen by 60% through this crisis, while the crisis intervention that we've done has actually increased by 339%. So as a direct reflection of our work being more reactive to the case as opposed to being proactive to it. And it's hugely impacted by the loss of space. And of course, this has increased, community complaints of public injection, of syringe litter, and our participants, of course, have lost their stable space and their location where they can have all of their basic needs met. The COVID-19 has just really impacted this further, further restricting our ability to use the space adequately, and having to socially distance and making sure that all of our vehicles are safe for our participants to enter. So we do have a proposal for a solution, and Alex will lead us into what that looks like.
Thank you, Adrian. And I do want to share, to give a little bit more detail about these numbers that we're seeing here on the screen, this 339% increase in crisis intervention services. This is specifically refers to our internal data collection on how many syringes we've been collecting on the street. So when we had a building and we were able to sort of, house our participants versus when they were displaced into the street in the following year, we had a 106% increase in the number of syringes that we saw outside alone. We have a public safety team who does sweeps of the area and Highbridge Park, picking up syringes safely. And to give you, a direct number, in the year while we were housed, we collected 191,000 syringes versus the 395,000 we collected once our participants were displaced and the problems were pushed outside. Further crisis intervention data numbers include naloxone, distributing naloxone within the community. People are looking for a direct crisis response, as opposed to the 60% hit that our case management intervention services took. So that's our HIV and hepatitis testing. That's our long-term case management services, housing, long-term treatment services. We found that when people don't have a safe space to touch down and spend a confidential time with their case manager, they are not able to access these services as frequently or sustain them long-term. So that's a little bit of insight to this graph that you're seeing right here. Now, as mentioned, we do have a solution that we've proposed throughout these 2 years. We have been looking for a permanent space, but it's been very difficult looking within our catchment area, and given the barriers that we faced as an overdose prevention center, we have certain limitations to where we can be placed. That being said, winters are very, very difficult working out of our mobile site because we just do not have the physical space to house participants nor staff, especially safely throughout the pandemic. So we desperately needed a solution while we find a building. And that is where this interim solution comes up. And we call this the Village. This is an interim emergency response solution to operate services out of what we call a village of 5 CDC compliant street side trailers. And this is placed alongside a block of Amsterdam Avenue between 177th and 178th Street. This is a block south of our current location, and the specific area fits all of our qualifications as directed by the city to where we can be placed. Now, this model will take us from a Winnebago and 2 small rental RV vehicles to, as you can see here, an expansion of 5 trailers. Now, this model will allow for a 150% increase in services. So this includes a resumption of suspended services such as HIV testing, long-term treatment coordination, housing and shelter assistance, food services, benefits navigation, advocacy, and job-seeking support. We'll be able to scale up our healthcare and critical case management services using telehealth and following physical distancing guidelines. In fact, we have a comprehensive plan here for social distancing that adheres to guidelines that is constantly being updated by DOHMH for how to reopen drop-in centers. So I will be able to have a bathroom trailer here that will give participant staff and the community access to sanitized bathrooms and running water. I'm sure many of you know, many of the public restrooms in the community have been shut down. And in fact, in the area where we are working now, 179 in Amsterdam, there are none, and we don't have any on our vehicles. So obviously no one wants to work in a pandemic without running water. So we've had to source hand washing stations in the meantime, but this expansion will allow us to have bathrooms, to have sinks, to have running water on site. Not only available to our staff and participants, but available to the larger community, socially distanced and regularly sanitized. We'll also have COVID-19 services available to the community at large. That's distribution of free PPE, masks, sanitizer, temperature checks, and COVID-19 education and referrals. A few additional benefits. We'll have 100% increase in staffing at the temporary site. So this will include case managers, healthcare providers, outreach team, and security, all there to serve participants and to engage the community. Again, like I mentioned, we have a full line of COVID-19 prevention protocols, including physical distancing and daily sanitation. We'll be able to increase our service referral and healthcare access, which will then result in sort of a decreased fallout that we'll see in the community. Greater access to these kinds of services means that within our population, we'll see a decreased rate of disease transmission. We'll see decreased rates of public injection, of public urination and defecation, and related quality of life concerns throughout our neighborhood. We'll have a dedicated security presence and cleanup around the village. And this will also allow us to have a 60% increase in hours of operation. Now, this model will be time limited. It is only an interim solution, and it will be scaled down as a permanent location is secured with an overlap and transition period to ensure continuity of our services. Will be authorized by a permit from the Street Activity Permit Office, from the Mayor's Office of Citywide Events and Coordination Management. And this permit must be authorized following community consultation every month. As you saw prior on the plan, we have been situated so as we will not be obstructing any public sidewalks, we will not be obstructing bike lanes or any park access points. And we've been authorized by the State Department of Health following oversight and guidance from the city. Finally, we do want to maintain community engagement and transparency with the community throughout this whole entire process. To that respect, we offer a public safety hotline that operates 24/7, and the number is here. This is for the community to reach out to with any syringe litter or public safety problems, or basically a direct line to the agency for any questions. And to further transparency and community engagement, we also have a monthly community advisory board to inform the implementation of this project and to deepen our relationship with the community. Our contact information is here if anyone wants to get in touch after this. And we can open for questions at this time.
Yeah, we have apparently several questions, but before I turn it, let me ask you, this, I'm going to want to see the PowerPoint because it was difficult to pick up on everything. So would appreciate if you would send it to me and I'll send it around again to the
And I
committee
apologize,
members.
it's a lot to get through in this short time. Absolutely, we'll send you more information.
But let me ask you, at one point, we thought that we might have been able to broker a something for you with, I forget the name of the drug rehab program that moved to around the corner on Amsterdam Avenue from 180th Street. Maybe they moved within a block on Amsterdam down to 179th Street. And they told us they had a floor or more that they were willing to sublease to you. Did you ever enter into discussions with them to see if that was a doable space for you?
Yes.
Yes, they do. Yes, they do. Yes, Go ahead.
Oh, sure. Yes, we actually did view the space, and we went through it with our consultants. But because of there was an issue with the entrance of the building, and it being a shared entrance with another program, it wasn't necessarily seemed suitable for our facility.
Oh, what was the name of that drug program?
That was Upstart.
Oh, yeah. They had another name and then they changed it. All right, so that turned out not to be doable.
Right.
All right, we have some questions. Catherine Diaz.
Hi, hey everyone. Hi, Adrian.
Okay.
I have 2 questions. So one just to confirm from the map. Is it between 177 and like where the bus stop is, or more closer to 178?
It is on Amsterdam, on the east side of Amsterdam, between 177 and 178. There's no bus.
Okay.
It's opposite the bus stop.
Yeah, that's exactly what I meant. But it is taking parking spots.
It is taking parking spots.
Right. And so I don't want to like diminish the role of, and one, I just want to thank you for the presentation. I thought it was an excellent presentation. And we all know the urgency and the importance of y'all having space, and particularly in my capacity when I was working with you guys. What I do want to highlight is I think the importance, and not necessarily diminish the importance of the board, but for example, like what is this same presentation going to happen at the daycare, at NYCHA across the street, at the clinic and the co-op across the street? Because, you know, on the board, we understand the importance, and a lot of that gets lost in translation because these presentations don't make it to the people on the block. And given that, for example, that the timeline is all the way through June, you know, and given COVID, we don't necessarily know what's going to happen next year. Even though it's not blocking the park, that park has multiple tournaments that brings huge crowds. It is, you know, a regular place for folks to hang out. And I do think that it is essential to not have repeats of like the last 2 years, to be able to, you know, really bring in those like deep presentations and conversations. And when I say that, especially around parking is a hot topic on the board. And around there, it is incredibly difficult to find parking. So I share that, and I guess it's more of a comment less than a question. So.
Yeah, no, I absolutely hear you. A couple of points. So I did mention we have our monthly community advisory board, and we are doing continuous outreach to the community. So this isn't just larger stakeholders that care about the syringe litter issue in our community. It's local business owners on Amsterdam. It's parent advocates on the schools on 182nd and 183rd. It's residents who live on Laurel Hill Terrace down the block from our service sites. So we're actively engaging folks through our public safety team who goes out into the community every single day for sweeps. We engage folks that way. We engage the folks who reach out to us through our public safety hotline and otherwise. And we invite them all to our community advisory board for feedback. We're proactive about reaching out to the businesses nearby. So if you have any specific contacts, you know, absolutely, these are the folks that we want to hear from. And yes, we do share the presentation with our community advisory board members. We did the presentation just about about 2 weeks ago at our last event. We do have it at the end of every month. And it is welcome to everyone in the community because we do want to keep people informed as the process goes. As mentioned, we want monthly community consultation because that is important for our permit approval. We want to keep the community informed and in conjunction with how we move. And that being said, it is a temporary project, so we are capped at 9 months in this area. And, you know, we have to do our due diligence on our end in regards to our permanent space search. So, we do have a cap. We will be following monthly community consultation. And we hope that this, we can build on that transparency with the community this way.
I'm sorry, Alexander, did you say that this would only last for 9 months?
Yes, currently, as we have been working it out with the state and the city, we have been capped at this location for 9 months.
And what is the timetable as to when you plan to begin?
So at this moment, we are just in the permit application process. And that is going in for submission this month. And after that, we pending permit approval, we'll be able to install.
So this is a permit application process to the city for the street activity permit, or the Office of Community, I forget what it's called, OCMC, something like that.
This is SAPO, Street Activity Permit Office at the Mayor's Office, as well as DOB.
Right. All right. So you're submitting permits to them. So this could happen relatively soon then, in the next couple of months.
Yes.
Yeah. Okay. Tanya, you have a question?
Tanya? Yeah. Hi,
Tanya.
Alexandra. How you doing?
Good.
I just have a couple questions. One is just, are there any other models that you know of, any other places that have done this, similar models, and how, did that work out? The other question is, what will be the criteria? I know you said you have to monthly get this permit renewed. What will be the criteria that will determine whether you will be renewed? What are some of the regulations or the criteria? Because one of the things that I'll be concerned about is that if one little complaint comes in, or if something happens, then you could just end up shut down pretty quickly. So I want to know, like, what will that entail in terms of the approval every month? What things could impact that approval?
I'll let Gail speak a little bit more to this as our city partner, but this is, like I mentioned, it is undergoing guidance from the city. So this feedback is pertinent to the monthly permit approval from the SAPO office.
Hi, everyone.
So I'm sorry, I may have missed this. The permit needs to be renewed every month?
Yes.
Yes, sir.
Okay.
Yeah, so the goal behind that is so that if there are problems with the site and there is sort of, significant issues, I think there'll be a variety of people who would be weighing in. Then the city would reconsider whether or not the permit continues. We haven't developed any specific criteria yet, but it's something we've been talking with the mayor's office about.
All right, that was Gail Goldstein?
Yes. Sorry.
Okay,
and are there any other models? Has this been done any other place? Do you know that?
These models, there have been other models, but not specific to syringe exchange. So
right.
One of the
so like
things we
COVID
know-
testing, emergency models, we've sort of modeled it after that in a sense, but for overdose prevention centers, it's a little bit unprecedented.
Okay, Sally, you have a question? Sally?
Yeah, it takes me a while to find my unmute. Great presentation. I'm thrilled that y'all are back. However temporary, and my questions just, how often do the community advisory boards meet, and how does one become involved? I just did a cleanup in Highbridge Park, and yeah, I mean, I think the location is actually ideal given what's going on. I mean, you go over that fence and there are people living there. We didn't destroy any of those homes, but I can imagine just on the other side of that fence, you're collecting a lot. We found now when I'm doing cleanups, I do have a syringe container that we can put them in, but that's our first warning to anyone on our cleanups, because we have kids and families and stuff, and don't touch. That's when you alert the site leader and we can get in touch with you guys. My question is, that's a lot of infrastructure. So are you renting those trailers? Okay.
Yes, so let me just start from the top. The Community Advisory Board meets on a monthly basis, and I can send, the next one will meet at the end of November, and I can send the invitation to Steve so he can disseminate it to the people here. Yeah, okay. These are rental trailers. They're quickly to be installed, quickly to be taken down, and are rented by month.
Okay, and then my last question is, what can we do to help? We passed resolutions in the past supporting your location, which we hope for by the bus terminal. What can we do to help? Do you need a resolution in support of your application?
Well, we are hoping to take this now to the general board at the end of the month.
What would happen is that it would come from this committee would be the committee to pass a resolution, and then it would be presented to the general board for approval at the monthly meeting, if we can cobble something together. And I'm not sure, that's obviously Steve, if that's a possibility, we can just resurrect our old resolution in support of this temporary plan and vote on it as a committee, and then we have.
I didn't realize that this was something that was going to require a motion, and I would like to see how. Did Ellie Buen, did the chair of our board agree to have you give the presentation at our board meeting?
So we attempted to get on the October meeting, but we're only able to get time on the public forum. 3 minutes. So yeah, exactly. All so right. We went to you guys, hoping that you could help us get on the next one.
Well, I think the better thing for us to do would be a resolution, and then that resolution is presented to the board. And then you can have 2 to 3 minutes. I think it says 3, but now it's 2. It says, it's a confusing handout, or the confusing visual, because it says 2 in words and 3 in parentheses, or vice versa. Anyway,
but there's a provision by which the chair can extend it, and he can also decide to just allow somebody to make a special presentation outside of the normal bounds of the public session.
And Steve, you could do that at the executive committee. Is fair on Eleazar to.
Yeah, I tell you, because this also kinds of sort of cuts across our committee and traffic and transportation. Yeah.
But the healthcare aspect, I mean, the opioid crisis is only getting worse. Yeah. And I know we've heard some.
I'm sorry, do the budget priorities we just passed speak to this at all?
I'm sorry, Darryl, what did you say?
Do the budget priorities we just passed speak to this at all?
Yes, they do.
Yeah. I think in a couple places.
In fact, I was going to give a report later on, but our budget priority to increase
mental health and homelessness.
What's that?
Mental health and homelessness are two of our.
It's referred to in the mental health community as double trouble, people with a mental health diagnosis and a substance use disorder, and it is a big problem.
We had a separate one for increasing substance abuse services in the community, including specifically opioid overdose prevention education and funding for syringe cleanups and collections. And that ended up as the number 6 priority overall for the board.
So we can refer to that in our reso.
Sorry, Steve, I know I want to respect turns, but I do think that this is significant enough, as we've had in the past with like other organizations, that they present at the beginning of the meeting. So I'm sure we can just send Ellie an email, a 5-minute presentation, so that board members can ask the question outside of the committee report, because I do think it's significant.
I agree with you.
Could I ask a question, please?
But one second, Darryl, did you already ask your question?
I didn't ask my question yet, no. I guess my question was, and this goes back to what Catherine was saying earlier, This is right next to High Bridge Park. And did you reach out to Jennifer Hoppe, who runs Northern Manhattan Parks for the Parks Department? And then there's also the head of the High Bridge Rec Center. I don't know if you've done outreach to them.
Not Parks. We did collaborate with Parks early on in the project because there have been many different variations of the projects, placements, and such. So they are aware, but not this the specific person that you mentioned.
Because
now,
I can't see it being problematic for park.
Absolutely. We did go through whether we would have to permit for parks and everything, and it turned out that we did not have to. Now, as far as the rec center, we are just a block up of this area, so we do already service around the rec center, and our participants do generally stay in that and live in that area already. So we are familiar with the rec center, and part of the community engagement process that we want to do is engage all of those institutions near us so that they know who we are, they know the services that we offer, and our public safety team is there to be of service of them as far as cleanups go. We want to offer that as a resource to anyone who expresses the need. And not only that, we're being proactive about going out there and asking who needs help.
Yeah. I mean, as long as I think there's a point person at least that they could, call immediately if there's a problem, that would be great. And
Well,
I just have one other.
I think we have to go beyond that. In the interest of full disclosure, I work for the Parks Department, and I'm the Manhattan Chief of Staff, and so I also work closely with Jennifer Hoppe, and I think it is vital, if I can speak wearing both of my hats, that there be, you may not be on Parks property technically, but in effect you are. And I think it's vital that you have a clear working relationship with the Parks Department. So I would absolutely encourage you to sit down and have a discussion with Jennifer and her staff, because you need to have a working relationship if this is going to work at all in our mutual interests.
Yeah. And Steve, while you had your other hat on, I'm going to put my other city agency hat on for a second. I work for the City Commission on Human Rights, and I understand you all have a workforce development program. I think Adrian was talking about. One of the provisions of the human rights law is that people in employment cannot be discriminated against under the disability provision for being in some sort of, for having drug addiction, if, there's a caveat, if they're in active recovery. So, I'd be happy to talk to you all more about that if you want to learn more about that.
If I can also just mention, we've been working obviously with Washington Heights Corner Project and Parks very closely for a long time. They've actually been key partners in helping to clean up the parks. I'm sure you guys know that. So we can help facilitate that kind of a meeting so that the Manhattan parks are fully aware of the plan.
Yeah. All right, Barbara, you have a question?
Yeah, I had a question about what you called your bathroom facility. First of all, you said it would be well supervised. What does that mean? Second of all, since you would be servicing both men and women and other, how would that be handled in a proper manner? And third, one thing that's been more successful in getting people into longer term services has been also to offer shower facilities. And you don't seem to offer that. Why not? Or maybe you should. So those are my sort of questions.
Okay, so each trailer has a crowd control supervisor outside. This person will be doing COVID screenings because anyone who comes onto our vehicle does need to, be screened for symptoms, or else they are not allowed on. That is part of our COVID-19 safety guideline. So in that respect, it is a controlled entry. It is a limited number of people who can come inside, only 2 people at a time, and there are separate entrances to the bathrooms, individual entrances. Now, as far as having showers, would absolutely love showers, but we had to limit the plan due to space, due to budgeting, due to several reasons. We were able to sort of scale up most of our services, but showers is one thing that's sort of at the tippy top that we weren't able to fit in. Now, given the temporary status of these trailers, however, if we are able to scale that up throughout the duration of this stay, we can absolutely do that and just switch out this restroom trailer with a combo trailer. As we did try to get one before, but especially with COVID, many of these bathroom rental and shower services are being used right now. They don't have stock because they're being used by temporary sites, temporary COVID emergency sites. So they are difficult to get, especially as far as showers go. But it's certainly something that we want to have, and we recognize how important it is to have it.
And did you say that each trailer will have bathrooms?
So we have not each trailer. We do have half baths in 2 of our service trailers, but there will be a separate bathroom trailer that has multiple private stations.
But are they separated? Because frankly, these sort of public bathrooms are often the site of mischief. And so
Absolutely.
You're saying that the supervisor would be outside, not inside. That's not a bathroom attendant.
There will be outside supervision and inside supervision. We will have the screener for COVID screening on the outside, and there will be a bathroom attendant indoors. Only 2 people are allowed inside the bathroom at one time.
Now, what kind of janitorial and maintenance service do you have during the day for both the syringe, the maintenance, the service area, and also the bathroom area? Is that thought out?
Yes, absolutely. We have a full suite of safety and sanitation guidelines, especially as it relates to the pandemic. After every use of the bathroom, it will be sanitized before the next person goes in. Our staff is trained on how to do that. And to top it off, they do a deeper sanitation in the morning and at the end, and we will have a separate cleaning service who will come every day to do professional sanitization and garbage collection. So yes, we do have a plan.
Okay, good. Okay.
All right. Catherine, are you asking more questions?
It's Betty. I wanted to ask, would it be appropriate for her or for them to do a application to the?
Betty, we can't hear you.
You can't hear me? Can you hear me now?
Yes.
Okay. The question I have is, would it be appropriate for them to do a presentation to Traffic and Transportation this month, since it involves that very sensitive topic of removal of traffic, parking stops? And if you wanted to do a joint resolution with Traffic and Transportation, would it be appropriate for her to do a presentation and get that information out to more people on the community board? Question.
Yeah, I actually, does Traffic and Transportation, when do they meet? Do they meet next week?
They meet on a Monday, and I don't have the calendar in front of me. It might be the 9th.
Yeah, it would probably would be a good idea to try to get on there.
They already met for this month. They met this Monday.
Oh, they already met. All right. All right. Well, maybe they should be on the agenda for the December meeting for Traffic and Transportation.
Or we can invite them to our meeting. Well, we're having our meeting now. Damn it.
Yeah. Yeah. No, I think you should get on the agenda for their next meeting.
Welcome to the meeting, Sally.
Damn it.
All right.
Any other video? I'm cooking dinner.
All right. Any other questions? Oh God.
So, Steve, can you let me, or I guess, can you just let us and also Corner Project know in terms of if next steps is that they're going to present either at the general meeting, and are we drafting a resolution, or is that going to get drafted in time for the executive meeting?
I would be happy to draft a resolution.
Yeah, but when are we gonna,
Y'all can- y'all can-
when are we gonna be able to vote on it? Well, you're gonna have to. Okay.
Could it be done from the floor? Like, can it be, isn't that something that can be done at the meeting?
Well, yeah, theoretically, yes. Yeah, it could be
Yeah.
brought up, under new business.
Yeah, that's why I was wondering. That could be another option, just to do it then.
Yep. That will give me a little more time.
Yeah, but I think more people have to hear about this, because, what my fear is, we did a resolution for the site at the bus terminal, and we got that through with some resistance at the full board meeting, and then I almost feel as though it got ambushed. Somehow then the whole thing went awry, and even,
Well, then why don't I do it in time for the executive committee? And then at least all the chairs can weigh in.
yeah. Well,
Yeah.
That would be better.
Maybe they should make a presentation at the
Okay.
executive committee.
So I will draft that and send it around.
I don't, Catherine, what do you think of the idea of having them make a presentation at the executive committee?
I think if possible, we can send the presentation in the materials for the executive meeting and make sure we can put it on the agenda for the general meeting and let everyone and send it, and Paola's on the call, so making sure that we send it with sufficient times for folks to review it, because it will be a repeat of the terminal.
Yeah, but
So
if
definitely, I think a reso by the executive meeting.
But
It
if
would
it's an
be good to
executive,
have representatives from the corner project zoom in to the executive committee meeting, because questions will arise. I would rather have the questions come at that meeting than the first time the questions are asked being at the general meeting.
Right. But I will add, Sally, like a lot of folks don't necessarily attend the executive committee, aren't necessarily in the loop in that way. So I think a twofold approach is appropriate. But for sure, as long as we can circle the presentation and forward it to folks before the general meeting, so they have an opportunity to get aware with it before, because it will dominate the majority of the meeting this month. And that's just, we know our people.
But I think it would be better if we could get a resolution through the executive committee.
I agree.
So I think it would carry more weight.
Yep.
Catherine, I think maybe the two of us could talk to Ellie about this.
Yeah, absolutely.
Okay. All right. Very good. So Alexandra, you're going to send me you'll send me the PowerPoint tomorrow or tonight?
And Steve, you'll distribute it to the committee so I can draft it.
Yes.
Yeah, Steve, I'll be able to send you an info sheet.
Okay, very good. All right, thank you. All right.
Thank you, everybody.
Okay, Mr. Rivera, I look forward to meeting you someday in real life.
Yes, I want to make one quick comment. Can you guys hear me?
Yes.
Yeah. So, I definitely am sensitive. We're sensitive to the question Catherine brought up, and a number of other people chimed in about regarding parking space, and we know how important that is. So just so you know, while we're putting a lot of energy into opening the village, it is very important and priority for us to find a permanent space. And Steve, you mentioned that earlier about that other space, and we really appreciate that. So really the goal is not to even be there the full 9 months, but to find a permanent space.
What about the old space that drug program had that they moved out of on 180th Street? Did you look into its availability and whether it might be suitable?
We definitely inquired, and I'm reaching out to having conversations with trying to get and have conversations with the landlord of that space. Yeah.
Yeah, I tell you, the more I think about it, the more I think, here you have a space that was used for I don't know how long, maybe decades, for a similar population, an overlapping population.
Definitely.
So it's going to be hard for people to say that you're maybe intruding or doing something that's not already been done in that particular space or in that particular building. And so, you might have you might have less of an argument than you would have elsewhere. I would go after that space.
Yeah. Do you have access to my emails? Because these are the exact conversations I've been having for the past month. So this is very interesting. I'm glad we're on the same page, and I'm telling you the exact conversations about the same space.
Yeah, I think that space would make a lot of sense.
Oh, yeah.
Thing is, with the December meeting, isn't that where we do the board elections, or am I messing up my dates?
No, that's the board elections.
Right.
Okay, so that's an even more important reason to do this at the executive committee.
Yeah. And just FYI, someone will probably ask how many parking spaces exactly will this take up? So if you can find out that information.
It's 10. It's about 10.
Okay, great.
You know something?
9 to 10.
I'm sorry, but in my frame of reference, the parking is not the most important issue here.
That's why you're not sharing the transportation.
Yeah, that's right. Okay, but there
But
are
it's
much
9
more.
months. It's 9 months. It's like a construction project.
Okay, there are much more important issues at play here. Okay, all right, we'll be in touch. Thank you.
Thank you guys so much.
Thank you, everybody. Have a great night.
Thank
Okay,
you.
bye.
Thank you. Nice to see everybody.
Thank you.
Bye.
All right, next on the agenda, nobody had a chance to look at it, but just before 7 o'clock, I emailed around a proposed resolution on the fireworks issue. I could read it.
Yeah. And just a gentle time check, it's about 9:15.
Right, well, we're coming down to the end of the meeting.
Just share it on the screen.
Yeah, you
Steve.
can share it on the screen, Steve.
Okay, I don't know how to do that. Paola, I sent it to you. Can you do it?
Okay, let me try.
All I can see is Sally
Barbara
wearing a wreath.
has a hand up. I don't know if that's old or a new question. Barbara,
What?
your hand
that's
is up.
old.
Did you have a question?
No, I should take it down. Sorry.
That's okay.
Sorry. There.
There we go. Thank you.
Okay, oh, great. All right, Daryl, now your hand is up.
I should take my own advice.
Yeah, you should.
There is no reasonable standard. It is simply illegal.
Well, there's a reasonable noise standard. That's the basis of the noise code.
Okay, well, I was saying in excess of any reasonable noise standard. Because
Okay.
you're implying in that language, that we sort of live with.
Whereas.
Okay, very good. Okay, the first whereas, the use and sale of fireworks is illegal in New York City. But despite this fact, it has become customary for people to set off fireworks in the period leading up to the 4th of July in the streets of the city, including in Washington Heights, Inwood.
Okay, in the second whereas, you say lasting beyond July 4th. I'd say beginning well before the 4th of July.
And-
We need to.
Started early June, yeah.
Yes. Okay, yeah, that's good.
And lasting well beyond July 4th.
Okay, beginning in early June.
I'd say in May.
It was May when it started, late May.
Okay, beginning
Yeah,
in late May.
From Memorial Day or late May.
Lasting well beyond July 4th.
Lasting well beyond. Okay.
That was this summer. The first whereas is what usually happens. And usually it starts a week or two before July 4th and beyond. The second whereas is what went on during this summer. So the first whereas refers to summers past.
Right.
Yes, that's the point of it.
So it should be often until 4 or 5 a.m.
Instead of saying this last summer, you could say in the second one, this past summer, or you could say in summer 2020.
Yeah, good, good.
Well, this past summer.
Right.
Yeah.
Instead
Mhm.
of last.
Mm-hmm.
I hope it isn't the last summer we'll ever
You
have.
can also note that it has been increasingly getting worse. Like, just that escalation is important to make clear. And also, I think you should state the number of 311 complaints because we had the most in all of Manhattan.
Oh, yeah. We can
And
add
I
that.
think that's important because it was like
That's a good one, Tanya. Yeah.
tens of thousands. Yeah.
And
Up-
also,
yeah.
the data,
Well, one second, one at a time. Tanya, do you have that number?
I do. Yes, I can get that to you. I'll get that. I'll look it up as soon as. Do you want me to give it to
Okay.
you right now?
No, you can send it later.
I'll send it to you. Yes, I have that. Mhm.
All right,
and the other thing I would add was the 311 is the data study that was done by the Respectful Decibels level, where they said X percent of which, 69% of which were dismissed without action. I mean, as long as we're being saying we need increased enforcement, we need to stress that it wasn't enforced. In fact, 311, which was our way to report, was basically closing them out within minutes.
Well, let me
I
ask
was
you.
wondering about that. Like, do we want to mention specifically that NYPD has not been
Yes.
helpful?
Call
Well,
them out.
I didn't want to really attack them because
Well, then just put the data in. The data
Yeah.
speaks.
yeah,
without
right. So
accusation.
is it really only 69? I hate to say this. Is it only 69%?
It might be higher. I can get the data from that group.
Okay, very good.
Study.
And speaking of the group, though, too, like that was formed this year. It might be good to include like how much that group grew just within a couple months.
Good point.
Thanks to Tanya and others.
Yeah.
I mean, how many people are in it now? A lot. Like,
I think over 800 or so.
has it hit 1,000?
Yeah, about 900 some.
Yep.
Okay. All right. Next is excessive levels of noise are known to impact the health and well-being of affected individuals, which is why New York City developed its precedent-setting noise code to restrict unreasonable levels of noise throughout the city. And whereas the fireworks in our community last summer were far in excess of any reasonable noise standard and adversely affected the quality of life of the majority of residents.
The quality of life and health.
What?
The quality of life and health, because we want to make sure that this is not just relegated to a quality of life thing. It's a public health issue.
Okay. But I want to make it clear that we're talking on behalf of the majority of residents.
All right. Okay. The quality of life and health.
Actually, I want to say the overwhelming majority.
Okay. Okay, then we should put the public health point and say the fireworks were also a significant public health issue in our community. It is believed that the fireworks caused at least one death.
Well, that's the next paragraph.
Right.
Yeah.
You could put the public health in that one
Mhm.
as the first sentence.
Well, it goes beyond just that, though. All right, I can work it in. Okay.
Okay.
All right, so it is believed that the fireworks caused at least one death. Wanda Borelli Ortiz has reported that her 83-year-old mother, Belkis Borelli, with whom she lived on Academy Street, had a panic attack because of the fireworks outside her building on July 5th, which turned into a heart attack, and a week later she passed away.
Mhm.
And whereas fireworks also caused a destructive fire in a ground floor apartment at 184 Nagle Avenue on July 5th, in which a family lost all its possessions, and a similar incident reportedly occurred on West 157th Street that same day. Now, therefore, be it resolved, Community Board 12 Manhattan calls upon the mayor to give this issue the highest priority in 2021 and to bolster interagency efforts to prevent the illegal sale and use of fireworks within the city and to increase efforts to stop fireworks from being brought into the city from nearby states.
What about enforcement of people who are doing it? Does that have a role, do you think, in this resolution? Because for us, it really was, yes, you're correct. People were there was a lot of the illegal bringing these illegal fireworks in, But once they're in though,
Yeah.
then it's like, what do we do? So it becomes an issue of there needs to be some enforcement
Yes.
part where the
Yes.
people that are doing this here,
Yes. Yes.
once it enters the space, that needs to be dealt with. Now it's really up to, like you can say what you want that to look like, but there should be some sort of way to stop
that was my intent. I dashed this thing off, unfortunately, just in a short time. And if you see by the heading of what I gave the resolution, my original intention was to focus on increased enforcement. So yes, that belongs here.
Well, I have to really, spoil the party a little bit. In terms of enforcement, you have to see what someone can be charged with for illegal fireworks. It's not much. I believe it's really almost just a disorderly conduct summons, which has now been put down to almost like one of these $1 summons. It's not much. So
I want to be clear what I was talking about, and I hear you, Barbara, you're right, because that's not a deterrent. I guess what I was talking about, I wasn't looking at enforcement only being harming, like saying giving somebody a summons, but also like enforcement, meaning that when we see this happening, that there are efforts to break that up, that it's not just about, okay, we're going to hand out a summons, but how do we, when we know there are hot spots, right? How do we enforce those hot spots so this activity won't even get started up, right? Because a lot of times the police will literally drive right by as they're lighting fireworks right in the street. So where is the enforcement in that, right? And what could that look like other than, I agree with Barbara, like these summonses are not deterrents. So
that's also because so many of these things have been fully downgraded to totally non-criminal.
Listen, I would be happy if they just confiscated the fireworks.
Well,
yes, absolutely.
Yeah, but when they do it, they don't take out many. They light up.
Yeah.
In other words, it becomes like a what do you call it? Guacamole thing. They take out the Roman candles or whatever, light it up, and then dash away.
Somebody needs to mute themselves because I can hear you talking.
Catherine, you have a question?
I wonder if, Tanya, are you kind of alluding more like preventative efforts over the word enforcement? Because what comes to mind in what you're sharing is kind of like, for example, let's talk about the FDNY and the hydrants. And obviously we know hydrants, that's part of a culture, like officially, but the FDNY has done a lot of changes over the years, and education and more targeting around what the opening of the water with the pumps. So I don't know if you're kind of like thinking along that direction in terms of like preventative work over necessarily like a summons and arrest and increased policing when we of course are talking about defunding and removing cops,
Yeah, and I think when I mean right, yes, prevention, but prevention in a way where we can cut the activity off at the knees, right? So we know that there are hot spots. So why can't we have more? Where can we? Oh, I got it, Steve. Where can we engage maybe the parks PEP officers? You know what I mean? Like some presence that can somewhat deter, or if we see it, we can have a way to patrol those hotspot areas or problem areas. And so there's a presence there that will deter some of that behavior, some of that activity.
Well, PEP officers can only be inside parks. Yeah. They can't be, for example, on Sherman Avenue where you tend to see.
The job here has to be done by the PD.
Yeah, it has to be done by the PD.
So yeah, I get you.
And for example, auxiliary cops.
We don't have to hash out these kinds of details right now. We just have to indicate that we expect them to do better and increased enforcement.
So Steve,
right.
Okay. I'm going to meet with the people who did the study, and so I will have a couple whereases that reflect the specific findings that will add some facts to.
Okay. Which study is this?
The one on the 311 calls, what was answered, what was not, and if there's anything else what Daryl suggested about the formation of that group and how quickly it grew. I will meet with them tomorrow morning and get something to you by the end of the day.
Very good. Okay, there are a couple of questions here from.
Wait a second, Steve, I would like to say in this, part of the reason that it was so bad this year is that the fireworks were able to get into the city. And the big reason for that was that in prior years, the NYPD used to send out anti-crime officers into the Poconos, and they would stay out there and watch these sites where the fireworks were sold. And they would watch for New York plates that bought large quantities of fireworks. Then they would follow these vans back into the city. And as soon as they crossed the Lincoln Tunnel or George Washington Bridge, they would bust the vans and they would confiscate large amounts of fireworks. And that really cut it off at the source. With the disbanding of the anti-crime units, none of this was done in the Poconos last summer. And it's also expensive to have, officers twiddling their thumbs, basically surveilling these various sites that sell fireworks out in the Poconos. So that's expensive, to have several officers all scattered around the Poconos. And with the defunding of the police, you don't have that anymore. So I think you have to have a part of this resolution when you call for increased enforcement. We also have to call for the funding of it, especially for funding so that we have squads and officers available in out of state to be able to intercept. Because that's
I don't really, that's opening up a Pandora's box. I do want to say that they need to do those kinds of surveillance activities, and they do have to stop it at the source and track people who are bringing it into the city. I like that idea. I don't want to veer off into this whole issue about funding the police. They should just find the money.
But I do, Steve, I just want to say one thing. I just want to be clear, like, people who are doing this, I'm not one of those people that say when you commit illegal activity that you shouldn't pay consequences. I just want to be clear that people have been died, buildings have been burned, people could have died in that building on Nagel in that fire. So what I'm saying is that I am not by any means suggesting that we should go easy on people who are out there, and these are not kids, these are grown people out there. Some of these people are grown men out there doing this. We should not, it's not that I'm not saying at all that they should not suffer consequences. If what you're doing contributes to a building being burned, where was the accountability for that? So
I want to know whether anyone was ever arrested.
And they should have been. And I just want to be clear that when I say the summonses, when we're talking about summonses not effective, yes, they're right, they're not effective. But what can we do where it will be effective? And we're not saying, people need to understand that this is a dangerous activity, like you're saying, Steve, in this resolution. This is a dangerous activity, real consequences.
These are explosives.
Where do we have
toys? These are not firecrackers and sparklers. These are M80s.
Yeah.
These are very, very dangerous. You can't walk out of your house. I mean, on 4th of July, I filmed all of the Emerson Playground. It was covered with detritus from the night before, and it was terrifying. You couldn't go outside. So fuck you if you wanted to haul.
All right, listen, we have two members of the public who want to speak. Bernard Grobman and Maria Garcia.
Okay, good. Steve, I want to say you can't talk about requesting something and not wanting to have it funded.
We don't need to plan an entire strategy. We just want the issue addressed. What Paola, can we upgrade Bernard Grobman and Maria Garcia?
Yes, and do you need me to still share the screen, or I can take it
I was
off?
just going to say, can we unshare it?
Yeah.
And Steve, can you send out the corrected one after this thing so I know what? Okay, good.
Yeah, well, but I'm not going to send it out to you. Send me your stuff.
But I don't remember all the changes that were made.
That's okay. I made notes of them.
Okay, can you just take a shot of your notes or screen share your notes?
Oh God, you can't even read this thing.
Okay. Type them in tonight. I sent you the last email.
What?
Hey,
Do we have to-
Steve, while we're waiting for Bernard to get on panel, can I ask just one more thing in your resolve?
Yeah.
In your resolve, you say very clearly your ask in terms of to bolster interagency efforts. But can we also add in that they should also engage with the community on potential solutions?
Good point. Good point. Tanya.
Because yeah, I just think that
Good
that
point.
should be a part of it.
Yeah. Good point.
Okay.
Is it my turn or?
Yeah, go ahead.
Okay. I wanted to point out that the bombs that were used at the Boston Marathon were made with fireworks. Okay, this is really serious stuff. And if I didn't even know that they had completely decriminalized the use of illegal fireworks in New York. But if you decriminalize something, why even bother having the law on the books anymore? You know what I mean? I mean, I watched guys outside my window over the summer. They're grown men. They're 30, they're 40 years old. You know, you're not going to take them in and put them in a softball league and suddenly they're going to stop doing stuff like this. And the other thing is, without actual criminal penalties, you'll never find out where they're buying it from because there's no reason for them to tell you. You know? So, I mean...
Well, in the past, the police department, I believe, did do, as Barbara alluded, they did stakeouts. And they knew the wholesalers in Pennsylvania and upstate New York and others who were selling these things in large quantities, and they staked them out and they followed people back into the city. So I think the PD has got a pretty good sense of where the fireworks are coming from.
I mean, just to bring up a very unpopular name, Giuliani even shut off the John Gotti fireworks. You know, so it can be done.
Yeah, it has been done.
It can be done, but without enforcement, if it's a situation in which there is no criminal penalty, the police will go past the guy. They're not going to stop up and get into a scene over some kind of a summons that costs $1. It's not going to happen.
Okay, I don't know what the facts are about that. Okay, Maria Garcia. Do we have Maria Garcia?
He's muted.
Maria, can you unmute yourself?
Can you type it in the Q&A?
Catherine, is that a new hand or an old hand?
Sorry, that's the old hand.
Old hand.
The only way she can type in the Q&A is to unpromote her. She can't type in the QA if she's promoted.
There's a Q&A at the bottom.
She's unmuted. Maria, we can hear you now. No, we can't. You're unmuted, but we still can't hear you.
Here I have.
She must have her volume down on her mic or something. She doesn't look like she's.
Typed in that she lives on Nagel and Elwood, and on the issue of noise pollution, I haven't slept in 3 nights because of cars with loudspeakers and restaurants on Nagel that have giant speakers. Well, Maria, you should call in those complaints to 311. They should be referred to DEP, especially if these are restaurants. Those are things that DEP can send out inspectors for. And she also says we are still getting fireworks as well. It is a public health issue because no one is getting any sleep within half a mile. Please do not respond to 311 calls. She's right. Okay. Users, Bernard says the users have to be arrested. The only way to get the sellers is to enforce against people selling them off. Someone else here, Lynn, thank you very, very much for working to address this problem. Fireworks, which made the summer in our neighborhood truly unbearable. It will be easy to push it to the back burner during the autumn, winter, and then the problem would start next year. Appreciate your continued focus. Thank you. Okay, very good. Okay. All right. Maria, you can also go, if you need any assistance, you can also call the community board office at 212-568-8500. But my suggestion is you call 311 and register the complaint about the restaurant with the giant speakers. That's a separate issue. I wanted to deal separately, at least in the beginning, with the fireworks issue, which was so paramount during the summer. All right, is there a motion on adopting this resolution?
Steve, I would like to clarify, if I would for a moment, the penalty for having fireworks. If you possess or explode fireworks, you're just charged with a violation. And as you know, that's pretty meaningless nowadays. But if you're caught selling or distributing, there is real teeth. Up to 90 days in jail for a smaller amount, up to a year in jail, can get up to 4 years in jail. So the issue is to catch the distributors. There is still real teeth in the law about distributing. But again, if you possess or explode a firework, you will be charged with a violation, which we know is like less than a traffic ticket.
Right.
Okay.
All right. So I think the tenor of the comments I heard earlier from committee members was that we didn't necessarily want to crack down on the people who were setting off the explosives in the streets. Is that correct?
No, I do. But I understand what's going to happen. What's going to happen is it depends. It depends. It depends on the severity. Like if that action, let's say, leads to a tragedy like Nagel or something like that, there should be some real consequences.
Yeah. Oh, well, that's
behind that. Right.
That's clearly a crime.
And also,
But I
if
say,
we can see
but I say
the
people-
fireworks at the point of explosion, that's a consequence.
Yeah.
The
Well, I
summons
think
and
people-
And a summons isn't nothing. Maybe they'll stop doing it. I don't know.
Yeah, I mean,
Yeah,
people
but
maybe
I
should get a
think that-
violation in the first instance, but there should be some kind of upgrading. If there's a repeated, if the repeated violations, people should have to do more than just pay get a violation or a simple summons.
And I agree with you, Steve. I just want to say, I don't want to take up all the space, but I just want to say one of the things that, have to be careful how you word this, because you're going to run up against the folks on the board who are the defund the police folks,
right.
who feel like, I don't care if you slit my throat, you should not go to prison. So, so I'm just saying.
All right, well, I'm one of those defund the police folks, so I want to just say something. I am against criminalizing setting off fireworks because I think there are circumstantial things, and there's community-based things, there's cultural things, there's a lot of factors into it. And when we bring police in and we start criminalizing folk for doing things like setting off a firework, we're setting off a perpetual chain of consistently being criminalized for things that other people, white people, would not be criminalized for. So I strongly am opposed to criminalizing people for setting off fireworks.
Who's talking?
No,
now?
I'm opposed to not getting sleep and having my blood pressure go up and having my blood sugar go up 10 points. That's what I'm opposed to. I got no sleep. I got no sleep
I have my
for
own
months.
Okay.
I don't think we're talking about criminalizing it. It's already
Right. That's not what we're saying. No.
You're talking about the enforcement of it, and I don't
There's a
know.
summons, right? So they're saying that a summons or a violation is less than a traffic ticket, right? They're arguing for more than that. So what I'm saying is that I don't agree with, which is my opinion. And I'm
What
entitled to
about seizure at the point of explosion? That's more than a summons. That's saying, no, you can't do this. These are illegal. They're not allowed in New York. We're taking them. That is
they can be illegal. I'm not saying that they should not be summoned. They should not be confiscated. I'm not saying that. What I am saying is if we move beyond violation, what are we moving towards? Criminalization, right? Like people are going to get arrested for having fireworks. People are going to go to jail for it.
We don't want that.
And I think that before we make that decision and make it like the arbitrary choice to like recommend that people are arrested for setting off fireworks, we should think about the consequences. That's all I'm saying.
No, I agree. And I don't think anyone's suggesting that it should be more than a summons unless maybe it leads to arson or leads to something like
exactly. That's what we're saying.
Just the fireworks, if they just go into the air, come back down, just a summons. I don't think anyone's pushing for
No,
That's what it currently is,
Right.
and that's what kept people up all summer long. And
But it
that's what
wasn't
essentially the
enforced.
police ignore.
As Steve Simon asked, how many summons were actually issued? We don't know.
Yeah.
Oh, not
All right, but
many.
again, I didn't really want to. I didn't want to get caught dealing with that particular issue in this resolution. So
Wait,
we're
I
not.
just have one more thing to say. Sorry. I think that, and I don't want to excuse this. Like
Oh,
I
who's
also stay
speaking
up.
right
I get,
now?
it's
Excuse me,
Naisha.
who's
It's me, Barbara. Naisha is speaking.
Naisha, thank you.
Yeah, go ahead.
So I don't want to get caught up in the idea that like I also don't get like kept up by fireworks, because I do. They're fucking annoying. Like I hate them, right? But I think also that when we like, I was under the impression that we were advocating for the criminalization or something more than a summons, which for me is like a very sticky territory, and I'm like uncomfortable with that conversation. I'm glad to know that we're not advocating for that. But on top of that, I want to say that the combination of defund the police, which was like exponential, like it was like a bigger movement this summer, along with the COVID, like it's like the intersection of all the things that people were experiencing in our neighborhood this year made things worse. That's not to say that last year they weren't bad also, they were. But I think we also need to be mindful of the fact that like there's certain intersections of things that are making things exponentially worse.
Naisha, what I was speaking to is the partial solution to the problem is to intercept them before the fireworks come in at the Poconos, so that they can't be set off. When you stop the distribution, the mass distribution, and cut off the source, that's
You
what
can buy
we're-
them on the internet.
Well, that's not as
That's why
possible.
we need it at the
I
point.
think we can only deal with the
Barbara, I
noise
think that
issue
like
here.
in order for us to like implement something that has a safeguard like that, like there's a lot of legal things that I'm not equipped to discuss, and like I don't know if anyone here is a lawyer, but I think that like to have set checkpoints or safeguards to like inspect people that may be trafficking fireworks is like at least above anything that I can like grasp in. So I think that it's important. There's a discussion to be had, but I myself cannot talk. Like I can't contribute.
We could do the same thing to stop them from coming into parks. We know where the hot spots are. We can set up cars that would stop them from coming into the parks, because they know that if they come into certain hot spots, they're going to be seized. And
All right. Do I hear a motion on whether to adopt this resolution?
I make the motion to adopt the resolution.
All right, is it seconded?
I will.
second it. I second it.
Whoever, Barbara, you go ahead. You take it, baby.
Yeah, I second it.
I think Tanya should make the motion.
I heard Tanya make the motion first.
Yeah, I rescind the motion. So we got to start over.
Okay, I make the motion to adopt this resolution.
Can
I second it.
Oh.
So Barbara seconds it. Okay. Okay, I'm gonna have to, where's the house?
And I'll get the data to you tomorrow.
Okay, all right, I'm calling the roll on this motion. Betty Lehman,
Yes.
Tanya Bonner,
Yes.
Darrell Cochran,
Yes.
Catherine Diaz,
Yes.
Naisha Diaz,
Abstain.
Sally Fisher,
Yeah. Yes.
Barbara Frazier,
Yes.
Jay Mazer,
Yes.
Steve Simon, yes. All right, resolution passes on a vote of 3, 6, 8 to 1, 8 to 0 to 1.
801. What about community members? Are we?
One second. Is Richard Allman still on the call? Any other board members on the call?
I see his name.
Yeah.
But I don't hear him, but I
His
do
name's
see
there, but his picture's not there.
And his microphone's not on.
All right.
Yeah, also, Bernard Grobman, wait a second, Bernard Grobman, Cheryl Miller, Lynn, Maria Garcia, and Nancy Preston are still on the call.
So can they type in their yes or no's to the question?
Yes. Yeah, in the chat, those 5, 1, 2, 3, those 5 people should put their votes.
Or they could raise their hands.
Or raise their hands, yeah. Bernard, Cheryl, Lynn, Maria, and Nancy. Bernard votes yes. Cheryl, Nancy Preston votes yes. Cheryl, Lynn, and Maria, any vote?
I think we have unanimous.
I haven't heard, did you hear from Cheryl, Lynn, and Maria?
Cheryl, if you can, raise your hand. Cheryl raised her hand.
Oh, yep. And
Lynn
Lynn
No,
raised
yeah.
her hand.
Maria?
Cheryl said yes in the chat. Maria said yes in the chat.
Yep.
Great.
Yeah.
We're-
Lynn said yes in the chat. They all said yes.
Okay, 5
Okay.
yeses.
Okay, so is that 5 yeses?
Yes.
Okay, very good. Okay, next on the agenda, old business. Tanya, you're gonna give us a report about the noise pollution task force?
Yes, and I'm gonna make it quick because I know everybody on people want to go. So, okay. Back in August when Steve and when Steve held the hearing on noise, the public hearing on noise, I mentioned then that we should have a task force, and there was an overwhelming community desire to have this be community led, so that's what was done. We have formed this task force. We have 22 members of the task force. And those members are very diverse and they represent various constituencies in our community, from small business to elderly, to our schools, youth, to our tenants, the people who live in our apartments and tenant associations. So we have and other community activists who have been very involved in this community for a very long time. As I mentioned, is extremely diverse in that way as well. It is also very diverse in terms of people who are on it. We have 12 of the 22 identify themselves as either Black or Hispanic, 8 being Hispanic and 4 Black and 9 white or Caucasian. And then we have 1 person who is Middle Eastern, who has been heavily involved in the Jewish community. And we are very represented in terms of evenly represented in terms of Washington Heights and Inwood, with 12 of our members being from Washington Heights and 10 in Inwood. We have most of the members, 17, both either live and work in our community. And there were 4 who do not, but they are we also have our community experts, our academics who are a part of this effort as well, going to bring a lot of that perspective with the work they have been doing on the connection between noise pollution and public health, because this is a public health issue. And so what's going to happen next is that we're going to be meeting this month and having our first meeting, and after that time we will announce who's there on the task force. We will have a community advisory component to the task force, because the task force will be doing its work and we allowing them that privacy, that space to do that. But we will have a community advisory component where the community can provide feedback, and it can go both ways, from task force to others in the community and vice versa, so that we are able to hear those perspectives. But we're going to be bringing in different constituencies before the task force to address, for us to figure out what the solutions are, what solutions could look like. And at the end game is to provide a list of recommendations / solutions with accountability, with who will be accountable for ensuring that those things happen. And so that's where we are. I'm very excited about the people we have. They're a strong group, and really excited for them to begin this work, to really begin to address this issue from a community perspective. Any questions?
Tanya, Maria Garcia said she'd be happy to help on the committee.
Oh my gosh, yes, Maria,
task
we got to
force.
talk. I can't, Maria, can you put your email? Because you can put your email in the chat. So I will screenshot it and I will get in touch with you. We definitely would love to have you be a part of this. This is, this is truly community led, and it's extremely important that happens. And it's an extremely strong group. So I want to please do that. And I will screenshot that now if you can do that for me.
It's in there.
Thank you. I'm going to screenshot it now.
All right. Will somebody be able to copy the chat before we close out?
I'm already doing it, and it started an email.
Okay, great.
I'll send it to you right after this.
So is that the same as the Q&A?
Yeah, it is. Yeah.
Okay. All right. Any other comments or questions for Tanya? Okay, very good. I just want to quickly cover two other items on the
I
old
have
business.
some new business. Oh, okay.
What's
We're not
that?
there yet. Never mind. We're not there yet.
Okay, so you may have seen the final list of FY22 budget requests from the community board as a whole. I'm pleased to see that 9 of our expense budget items were within the top 25, which is supposedly the cutoff for how many you're supposed to be able to submit to OMB. And once again, the number one priority for the board as a whole was to expand mental health services in the community. The number 3 priority for the board as a whole was to increase staff to conduct regular noise enforcement, air quality monitoring, and water quality testing. The number 4 board priority was to increase services to prevent and treat chronic diseases such as Alzheimer's, diabetes, cancer, heart disease, and hypertension, conditions that increase susceptibility to COVID-19. The number 6 priority was to increase, as I mentioned before, substance abuse services in our community, including opioid overdose prevention, education, and funding for syringe cleanups and collections. The number 9 priority for the board was to increase trash basket collection on commercial streets, fully restoring the FY21 budget cuts. The number 13 priority was to increase funding for a targeted educational outreach campaign for COVID-19 prevention and support services in underserved communities such as Washington Heights, Inwood. Number 22 on the list was to increase HIV/AIDS prevention and treatment services. And the number 23, I left out number 16. Number 16 was to provide funding to ensure that all local public schools have multi-service health clinics with nurses and social workers. And the number 23 priority was to increase pest control efforts to eliminate rats, cockroaches in our community. On the capital budget, our number 1 priority became the number 9 priority of the board, which was to expedite the replacement of old water mains and sewer lines. Our number 2 was the board's number 12, to provide additional garbage collection trucks and street sweepers. And our number 3 was the board's number 20, to install green infrastructure such as bioswales to divert stormwater from the sewer system. Second, number 2 for me on old business, the city's ratings on
Steve.
Yeah.
Sorry, I had a question on that. I saw another committee had something that talked about getting more Spanish speakers for health inspectors.
Yeah, I think that might have been under business development.
Should that have fallen under their committee, or should that fall under our committee?
Well,
I think it's
I don't know
something
if
that
you
Ellie
were-
had wanted.
I don't know if you were, it really should have probably come to our committee.
Maybe we could, oh, well, it's too late.
Maybe for next year, I'm saying we could.
But I tell you, there was I don't know if you were at the budget hearing, but it was a little dicey to try to convince Faye Florman that the item that she had put under her committee for mental health services really belonged to us. In the end, they were combined, but she also has an item for youth suicide prevention, which ended up as the number 32 priority for the board, which to me is a shame.
Yeah.
But to me, that falls under what we had in mind for expanding in mental health services, and we included youth in that category. So I don't know that she needed to have a separate one. But yeah, I mean, there is overlap, and it's hard if there's no real There should be a better system in which we can review these budget items and combine them and simplify the process for the board members.
Yeah, that's a little unreal.
Yeah. Okay, it is
Felt like
unreal.
I was
Okay.
in kindergarten.
On the ratings for clean streets for September, we dropped down to below 80%, which I believe is a threshold we're supposed to maintain. So we were in September, we fell to 78.4%. The previous month, we were over 92%. So this was a pretty significant reduction, drop in our ratings. And on the sidewalks, we were at 97.9%. Is there any new business? No new business.
Yes. I have.
Get these votes counted. Sorry, go ahead, Sally. I'm sorry.
I have 3 items. One is getting Fountain House on the agenda for December to come and present both on the services they offer in our district, but also what they're doing citywide with decriminalization of people with mental illness. And they can probably answer questions, a lot of questions that come up when we're looking at other proposals, like the double trouble, which affects the substance use disorders. So I don't know if we have room on the agenda. There's another group that has presented to the Aging Committee that would like to present on sustainability and environmental work that they're doing. And that group is Friends of Inwood Hill Park. Again, we'd like to be on the agenda for December or January. And then finally, I think that we should recognize, which we didn't do in the general meeting, I think we should recognize the death of Cecil Corbin Mark.
Yeah.
I think that's really important. And also, oh, I did have one other resolution to propose, that we cobble together something more current on the New York Presbyterian resolution, given that COVID now impacts it, and it's a whole lot easier not to open a unit than to close a unit. And I think that we need to be very hard hitting with the hospital. It's frustrating to refer back to 2016 or whenever they originally did their work. I think we need to bring that up to date and put it in a COVID perspective. I would be happy to work on that resolution.
What you're talking now about the psych unit at Allen?
Yes. And what they're, and the capacity that's being lost citywide, because those were the alternatives they gave us to the loss of the psych unit. Well, we've lost 50 beds at Brooklyn Methodist in the Columbia Presbyterian system. They've closed down chemical dependency units. So they're shrinking capacity all over the place. You know,
Steve, just to piggyback off of one of Sally's earlier comments about next month's meeting, it's World AIDS Day next month. So I know we usually have someone come speak about,
oh, that would be great.
AIDS.
Can we do a proclamation? Like, do we do that?
No.
Like at the general board meetings, like just recognizing something like that? Is that something?
And you can,
Well,
you can actually drop off.
It's interesting that you mentioned that too, because the other thing I wanted to mention along those lines was next year, I think it's in June or July, will be the 40th anniversary of the first report in the New York Times that many people are familiar with, called Gatekeeper.
No, yeah, 1981, right?
Yeah, 1981.
Nice.
Yeah.
So that the 40th anniversary of that is coming.
We should look forward to a big celebration of that.
Do you have a suggestion for a speaker on World AIDS Day?
Well, who was the doctor that spoke last time? I thought was really good. What was his name?
Yeah. The one from Columbia, he was really good.
I forget right now.
We can look back at it.
He's been to a few of our meetings, but yeah, he's good.
Yeah, but would like to vary it if we can. Okay.
I know someone at the New York City AIDS Memorial. They're down in the village, but you know it's a city.
You know, now that we're remote, Steve, even though Harlan has moved out of Inwood, maybe he could zoom into the meeting.
Oh God.
I like this presentation.
It just would be so cool if we could start recognizing some of these things in proclamations, just as just a formality, just acknowledging, right? It
Yeah.
doesn't have to be anything, it's not like involved. It's just a statement, a brief like proclamation that somebody would get up there and just say, or get up there. We're not getting in there. We'll just read it and we keep it moving, right? It's just like, yeah. It just would be nice, if we could start integrating something like that in the process.
So you're suggesting that with respect to World's Aid Day?
That's right, the proclamation at the general meeting.
Yep. I mean, now that we've done a street co-naming, we might as well do a proclamation. I think that would be nice.
More than a happy
we only
birthday,
recognize
less than a
people when they
logo.
leave. We should recognize people for the work that they've done in the community.
Yes, that too, Sally. Yes, all of those things could be proclamations, and we should just do. Yeah.
What did you say, Barbara? I didn't hear you.
I said more than a happy birthday, less than a rezo. Just something that, you acknowledge and.
Yes.
That's one way of putting it.
I like that.
Okay.
Yes.
Are we ready to adjourn?
I believe so. Are there announcements, or are we ready to adjourn?
So tired.
Steve,
All right, very
just
good.
one thing. Steve, you're going to follow up on that grab and go connection to meals connection to the woman with the distribution of masks and stuff.
Well, I'm going to suggest that she stay in contact with Betty Lee. If you want to send me contact information for the Star Senior Center and the Y?
Betty has it.
Yeah.
And I'll give you information for the Dykeman.
She can go through.
I have all the.
Betty has it all.
For the senior center, so I can send that on.
Betty, do you have the Dykeman food distribution? I know the woman is on the aging committee.
Oh, Carol Weeks.
Yeah.
Carol Weeks.
Could we include her in it because she knows what's going on at the Dykeman houses? I would also like to be on the list because I want to do something in Woodhill Park.
Yeah, I have Carol's phone number, interestingly. I don't have an email for her, but I can call her and get the email.
Okay.
Well, I'm sure Mary Anderson.
I might have her email. I can send it to you.
I'm sure Mary Anderson has all the senior centers.
That's it. Well, Betty has it all.
Well, either way.
Okay.
The list. It's
All right, let's adjourn this meeting at 10:02 p.m. Thank you all.
Motion to adjourn.
Second.
Okay, Steve.
Okay, very good.
Steve,
Have a good night.
Okay, bye.
I like your mom's picture. She's a beautiful woman.
Oh, thank you. Thank you.
All right, please send me the stuff from the chat.
Okay, Steve Simon, I
I'm
just
gonna send you
want
the
to talk
stats.
with you briefly about the ring garden. Did you?
Oh, we both need to, but let's not do this in a public forum.
No, and let's not do
Or
it
we
tonight.
could stop the recording, maybe.
No, I
If we
have a
don't do it
conversation
tonight-
with my Capital guy tomorrow at 1:00. I'll talk to you after that.
Okay.
Oh, okay, great. Okay.
So we'll call you at 3.
I got a call at 2:30, so 3:30. Bye.
Okay, 3:30 tomorrow. Mwah, it's
Bye.
a date. Okay. All right. Bye-bye.
Bye.
So Barbara, we'll do the conference call thing again.